Ashinda di nisa surat di penigi bigi. Ni thaya sundo ni kuro di penigi bigi chayana disa. Akhir ni seziya teo ya teo kude. Anish bin nahal kan ya teo adan galadi ya pinda arushin pushin kinne adi khas arsun khabs kun bondole. Here in the Washington area, so couple from North of Lake Pond. Ye hello a covenant. She the Adorani for the Health Education Human Services Committee. I just now the should need the nigga yet a Mihna Nishigi need 8 or late. Ada Hassan so we can and Hada is no Hada than without you can understand. Nada, you see the needs and without a Hashin so Bakati loss. We are HB, but it's so they are HB Bani without a ended and hit and hit it, then give a finish. The loudness and it's an easy to be water. So for those that so there's a bay need out a be water. So that without a Hashin so ben yet any so that a heg is up when it's done only. That without a Hashin so so that I hate because it is so what I be because it is on. Go quite go show by cases and do as one can then cover from Norway. It's an Arudan, the Swedish family, ask for the Federal Sogoni, Dean Hini, Kayan, his power. So you now, one nation get it no. The Latin past the tide or kid of the side or the base pass. Partners say that a Arudas from Padi Nishito, his net art, actually that a in a function. That a sensitive case of this. Yoda, he need no what I said, I know, and he not a yes, so this. Ala Niego nation, that we not what I mentioned. He need hands, Nigibenina, so it's the Hasin, so a Benassi, Nana for Nisi, so. Go towards the equation you see larger than the year. Indeed, Mr. Year, a co Haiti, a Koda name with the Hazin so. Never Hana for Nisi or Shahada station, Saho. I said I gave what out with young Abiva to the needing it, but not needed at our turn, no any Hanana, no bar in there. Well, I should be half on it to know the face out with the basically. Other way, not in eating. The other aunt kitty to need a kiss of. So, a nail water with the young again. I don't know how to say it, but I say that a call in now the Bagani, Hashin so, as I basically a deal to a viewer. So, acquire by Haywins and one down his whole disconnect. But the car is aimed. I would say that those are that they be what so hard to the reason of what I don't need to be had a deca. The Kokaido Banda Ika, I don't be not for the thousands of so we got Banda beating he will skate us so. He was your finance that he needs to add the Kaido, and then he should have made it. I think so in yet that any yet in yet any Baba native or the so yet I think so it is below that is letting yet what that is me. I don't get one no yet indicate that or ask so that one and have a one law. This is that now so that the yet that I can understand yet and the city to lead to yet on hand to so they are Hutchins, so the Sasoida, Nita, which is not a but of the distance. But I need the one don't get it or us. So when so a could also so this is we are not as easy or this. So 80 Jesus Christ. Amen.
Thank you very much, Trey, for the prayer this morning. Committee members, we're at announcements. Announcements.
Alan.
Oh, yeah. Okay. Give an announcement, Mr. Begay.
No, I just like to inform the committee that I'm online to do the report when you guys get to the report. I appreciate it. Thank you.
10-4. Well, I guess we've now entered the recognizing guests and visiting officials of our agenda. We have Delegate Begay on the line. He'll be presenting a report under 5C, which might change to 5B. And then do we have any other delegates from other committees that are joining us this morning? I'm looking at the listing here. Let's see. Doesn't look like it. Okay, moving on to review and adopt the agenda. A couple notes before the chair will entertain a motion. We are appreciative that Fort Defiance Indian Health Board was able to adjust their schedule and convene with us this morning. I don't know if I think it's their secretary or the person who assists the board. I sent a confusing email yesterday saying, well, we'll just meet in the afternoon and keep things consistent. But they were able to rearrange things. So I for one, am very appreciative of that. And committee members, they had committed to meeting with us this afternoon at 1 p.m., which was the original plan. But because we've removed, and we will be removing item 5A from the agenda, chair is not going to be with us. And I think there's some other items that need to be addressed before we can have a proper discussion on 5A. That's the briefing on the New Mexico educational impacts. And additionally, one of the big features is them getting a piece of legislation together for the nation to support and get behind. And then my other ask would be, I still don't see Delegate So on here, but she had requested from us a report from Whitehorse High School. And so I don't think it would hurt if we just add that to the agenda. If they're not here and she's not here when we get to it, we can always move on. But I think that would be a new 5C. So the chair will entertain a motion, but we need to delete 5A and then add a 5C. So thank you.
Mr. Chair.
Committee members.
Mr. Vice Chair.
Yeah,
this is Angie Benelli. You also have.
Benelli. Sorry.
Yes. Okay. You also. Okay. Yeah. Your agenda, and Charlene So wanted to add Kim Schaefer. I believe she's a principal over at Whitehorse High School, and then also Chair Daniel So yesterday had indicated that he had requested an update from Dr. Jill Jim regarding the Delta variant. And also the other note is we have a new staff with OLS. He's an advisor. His name is Rodney Tahi. So he's going to be kind of like just getting used to the meeting format. So he's going to be assisting Hess as an advisor, but I'll be on the line here, and he's just going to, see, just to get some experience. Mr. Vice Chair.
Okay, thank you. Yeah, so the report of 5C, it's Delegate Begay, and then Dr. Jim knows that she's supposed to be participating in that section of the report as well. And she's listed on there. But that's what I was saying is we need the report we need to add the one from Whitehorse on. So the chair will entertain a motion to adopt the agenda.
Vice Chair, this is Monica.
Thank you. Is there a second?
Second, Delegate Paul Begay.
Okay, committee members, are there any
Mr. Vice
amendments?
Chair.
Ms. Benali?
Yes, Mr. Vice Chair, the agenda needs to be read into record. Thank you.
Oh, okay. Yeah, just looking at it right here, assuming we all have memorized it. Okay, Ms. Benali, please read the agenda into the record, or Mr. Tahi.
I can read into the record. The proposed agenda for the Health, Education, and Human Services Committee for the 24th Navajo Nation Council Special Meeting is scheduled for July 28th, 2001 at 8:30 a.m. Presiding is Honorable Daniel E. So, Vice Chair, Chairperson, and who's excused, Honorable Carl Slater, Vice Chairperson. This meeting is held by teleconference. Item number 1, call the meeting to order. Roll call, invocation, announcements. Number 2, recognizing guests and visiting officials. Number 3, review and adopt the agenda. Number 4, review and adopt the journals. None. Number 5, receive report. A, briefing and implementation of the Navajo Nation Secretary Sovereignty, including implementation of the Yazzie Martinez versus the State of New Mexico. Presenters are Chad Albeda, Office of Legislative Counsel, Ron Haven, Office of Legislative Counsel, Dana Barbaroff, Chief Legislative Counsel, Patricia Goni, Acting Superintendent of Schools, Doty, Dr. Calvin White, Education Administration, Office of Dinesh School Improvement. B, review and briefs, legislation number 0095-21, an action relating to Health, Education, and Human Services Committee recommending for the approval of the Navajo Committee the designation of Fort Defiance Indian Hospital Board Incorporated as a Navajo Nation tribal organization for the purpose of contracting with the United States Indian Health Service and authorizing it to negotiate and enter into Title I Indian Self-Determination Act, Public Law 93-638 as amended. Contracts and Title V Self-Governments Compacts pursuant to the Indian Self-Determination Act, Public Law 93-638 as amended. Such designation of a tribal organization being revocated and contingent on compliance with all terms and conditions as required. Sponsors Edison Wanika, Council Delegate. Presenters are Tosca Medical Center, Dr. Sandra Atkins, Chief Executive Officer, Dr. Michael Tuff, Chief Medical Officer, and Christine Vicente, Chief Financial Officer. The Board of Directors, including, I'm sorry if I butchered your name incorrectly, Osona Tom, President, Alex Montoya, Vice President, Benjamin Dodge, Board Member, Reverend Anthony Davis, Board Member, Don Yazzie, Board Member, and Lily Roanhorse, Board Member. C, report an update, COVID-19 and Delta variant, health issue regarding Navajo veterans. Presenters is Delegate Key Allen Begay Jr. Available for presentation is Dr. Jim Jill, Division Director of Navajo Nation Department of Health. Old business, none. Number 7, new business, none. Close the meeting, announcements and adjournment 8. And next meeting. Honorable Slater, that's the proposed agenda.
Thank you very much, Mr. Tahi. I had recognized a motion from, I think, Delegate Wanika and a second from Delegate Begay to adopt said agenda. Those will stand. And committee members, can I get a motion to amend if that's in the committee's interests?
Vice Chair Slater, my motion will be with the recommended changes.
Okay, so the recommended changes are deleting 5A and then moving up the subsequent reports and then adding a new 5C, which would be the report that Ms. Benali referenced with those reporters. I think it was Ms. Schaefer and some other individuals, and then an introduction by Delegate Charlene. So, committee members, are there any other amendments, deletions, etc.? Okay, amendment solutions going twice. 3 times. Mr. Mose, can you move to a roll call vote on adoption of the agenda?
Yes, sir. Good morning, everyone. Honorable Paul Begay Jr. Honorable Paul Begay Jr.
Paul Gay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Halona votes green.
Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Vice Chair, vote of 3 in favor, 0 opposed.
Okay, so we'll move on down to item 5A, and that's, Ms. Finale, can you read the title for 5A? Mr. Tahi, I believe.
Honorable Chair, the 5A will be review and brief legislation numbers 0095-21, an action relating to Health, Education, Human Services Committee recommending for the approval of the Navajo Committee the designation of Fort Defiance Indian Hospital Board, Inc. as a Navajo Nation tribal organization for the purpose of contracting with United States Indian Health Services and authorizing it to negotiate and enter into Title I Indian Self-Determination Act, Public Law 93-638 as amended, contracts and Title V of self-government's compacts pursuant to the Indian Self-Determination Act, Public Law 93-638 as amended, sex designation of tribal organization being ratified and contingent on compliance of all terms and conditions as required.
Motion, Halona.
Delegate Halona, I think it's been our practice that we've permitted the presentation, and then the chair has asked for a motion and a second to adopt the reports. And so we're going to stick with that practice. Should I be recognizing Mr. Tom or Dr. Adkins first?
Probably Dr. Atkins.
Good morning, Delegate Slater. This is Dr. Adkins. Mr. Tom is right next to me.
Okay, well, you're recognized, and we'll start with, I'd say at 20 minutes. That's kind of the standard presentation time. The point of this presentation was to give more substantial time for you to present and then for the committee to ask questions of you. And despite it not being in a work session format, that's the sort of assumptions we're going to be operating under. So thank you much, and you're welcome to proceed with the presentation.
Thank you.
Thank you. Kehala, Nadada Mashini, Shea Osintio Tom, Tashjanido, Kaban Slont, Nadine Bashin, Katnazani Dashedo, Hanagani Dashnel. I want to thank you all for allowing us the opportunity to share some in-depth discussions with you all today. As you all know, that we're how the model works for 638 hospitals is we seek authorization to contract healthcare via the Navajo tribe as a tribal entity, and our expiration for our current contract date is December 31, 2021. Prior to that, we want to make sure that we have all of our authorizations to proceed into 2022 and beyond. For that purpose, we have submitted a request to receive additional designation from you all that covers a span of about hopefully somewhere in the 10 to 15 year range, so that we can continue to effectuate the healthcare practices and policies bestowed on a healthcare facility previously held by Indian Health Services. We want to make sure that all your questions are answered, and we want to make sure that we continue to do the best we can for our communities. Fort Defiance Indian Hospital Board Incorporated represents 16 chapters, and we definitely do our best to make sure each individual receives the care that they seek at our facility. We definitely want to make sure that we're trying to work in tandem with each of the 16 chapters in concert with the other 638 organizations. And so far, we have received support resolutions from all 16 chapters, and we also have received support to proceed from the 638 Self-Determination Organization of the Navajo Reservation. It's not really Navajo Reservation centric. However, the 638 hospitals of the Navajo Reservation do participate. Utah Navajo Health Systems, Tuba City Healthcare Systems, Winslow, entities from San Carlos, Canyoncito, they all participate in this consortium and has also endorsed our request to continue to provide services to our people. From an internal perspective, I'll go ahead and yield the floor to Dr. Atkins, who will add additional intel to this process, and hopefully we all have a good discussion today. Kiatla.
Thank you, sir. Good morning, everyone. My name is Dr. Sandy Adkins. I'm the CEO for the organization. I've been the CEO for about 6 years now. I've worked at the Fort Defiance Hospital when it was still a federal facility. And then when we transitioned to 638, I worked in several other different positions or roles, and took this position as the Chief Executive Officer in 2015, late 2015. And we really appreciate the time to speak with you and meet with you today. Just to add to Mr. Tom's initial presentation, so we have been, of course, I just want to kind of hit on the work that we've done throughout the pandemic. Early on, we were inundated with patients, and we were able to manage that and try to keep everyone we could here on site as best we could. We know we had to send some people out. In addition, once we got the vaccine, we began moving forward pretty quickly with disseminating that to our community members, particularly our high-risk groups. And our goal moving forward with additional years of reauthorization is to continue to expand that and ensure that we are able to reach our remote community members with whatever boosters or any other vaccines that may come down the road. As we were able to see very acutely during the pandemic, public health is just, it's huge. It touches everybody, and we can't ever say that something that happens on the other side of the world is never going to affect us, because now we know for sure that it can. We need to stay ready for that and abreast of that. And that's our goal moving forward, is to ensure that we can continue to reach out to our community members and work with other facilities in the area and form partnerships so that we can make sure our community members, if they do need to go to another facility because we're full, like we were during the height of the pandemic, that we're able to keep them as local as possible, and that we can work closely with those other entities. We'd also like to look at expansion. We know that mental health has been a huge outcome, an unintended consequence of the pandemic. It's touched every facet of the work that we do, from our patients, their family members, the people who were sick with COVID, and their families who had to manage that and go through that struggle with them, not being able to see them for a time, and how that is worn on them. In addition to our employees, our physicians, our frontline providers that had to work so closely on this, and day to day not knowing what would happen by the end of the day, how we were going to manage with limited supplies, limited resources. So we know that that's a huge issue. We would really like to make that one of our primary focus moving forward, and to add additional mental health services. We know we need to bring it out into the community. We need to have more available. That's with additional years of reauthorization, we can expand that service as well as our primary care. We know that many of the people that were sick with COVID, they're termed long haulers, as you probably heard that in the media. Those folks really need to be followed. They almost need their own specialty clinic to add to, to follow them closely with their oxygen requirements. We don't even know what that looks like. We don't know how long those folks will be followed, what type of services they may need in the months coming within the, next 6 months. This is all new to us. But we know that those people need to be watched very closely. And we hope that we're able to wean them off of the oxygen and that they can resume pre-COVID life, but we don't know that. So we feel like we're reinventing the wheel, with a lot of the work that we're doing. But our hope moving forward, again, is just to be able to add these services and change the way we deliver medicine to our community and out into the communities based on what we've experienced in the last year and a half. And we all heard about the Delta variant, and I know Dr. Jim may be on the agenda later speaking about that. That's something we need to watch for. We need to see what comes our way, how strong it becomes, and protect ourselves again. And we know how to do that. We did that for a year and a half. But that's something we need to really work on. And our teams are putting their heads together already to see what we can do to manage that as it comes down the pipe. I don't know if there's any other services you want me to speak of, Mr. Tom?
No, I think that's good for introductory.
Okay. That's our introductory. I apologize if I left anything out. Please let me know if there's any other issues I could touch on for you.
Okay, so this concludes the presentation?
Yes, sir.
Okay, thank you much. The chair will open the discussion to committee members. Questions?
Chair, this is Delegate Wanika.
You recognize Delegate Wanika?
Thank you, Chair. I just have a question. I know we had decided, based on your recommendation, you wanted to have a work session on this before we present the legislation for approval. But the question I have for you and Angie is, are we going to be approving this or sending this forward for approval by Nabigiyaki? Are we going to do that today, or is this kind of like just questioning the fortified hospital? Or do you need me to go ahead and present this as a legislation for approval today, Chair?
Thank you, Delegate Wanika. This is I think it was titled Review and Briefing, so it's not going to be considered as old business, as a business item for passing the legislation out of the committee. Thank you for the question.
Okay, thank you, Chair. I appreciate that. I just want to go ahead and explain my reasoning to sponsor this particular legislation. I am in agreement with the committee members for the concerns that they have, but I feel that there's a separate process that we need to go through, because there are complaints that come in all the time from patients who are coming to the hospital for services. Sometimes they have to wait for a long period of time before they see a doctor, and then when they go to see the doctor, sometimes they don't get the services that they expected. Sometimes the communication is a problem, or some others, I feel that's consistent throughout the service units that we have throughout the Navajo Nation. I feel that should be separate. That should be consistent as far as the hospital administration to address that. I know there's some issues that are very concerning as far as the seriousness of those complaints that they have. And I think we need to address that. And I think we need to address it with the service units. But I think if there's anything that's not being addressed, I think then it comes to us. So I feel like as far as this reauthorization is separate, where the hospital has plans to, just like we were just, information that was provided by Ms. Atkin as far as adding services to the hospital and for asking for supplies, this and that, and what service units or hospitals need to do to improve the services to the people. I think that's having to do with the recontracting that they're asking for. And so, but I do have some concerns, and the limited amount of time they got this past reauthorization was mainly because of myself, because I had complaints in reference to going to the hospital. I always say to myself, that a lot of times when you're working, you're told, you don't have to go to PHS, because of this and that. You're working now. You have insurance. You can go to a hospital outside of the Indian hospitals. It's better for you to go outside. And I used to always say, no, I don't want to. I want to go to the PHS hospital. I want to be an eye and an ear for the people, for the elders, so that I can advocate on their behalf. And that's the reason why I used to always go, and I still do. And for that reason, I had concerns, and that's the reason why I asked for limited time. But I think as far as their planning and all the things that they want to do, I think it's best that we extend the time for them. And I think we need to keep that separate. So I just want to make that request. Thank you, Chair.
Thank you, Delegate Wanika. Committee members? Opening the floor up to you. Okay. Additionally, I know we might have other delegates who are on the line listening in. I'd like to provide an opportunity for you to comment or ask questions if you desire. Okay, if you don't at the time, is that someone?
Yes, Delegate Holder.
Delegate Helena, would you like to make a comment or ask a question?
I'd like to ask a couple of questions, Vice Chair.
You're recognized, Delegate Helena. Thank you.
Thank you. Good morning, committee members and our presenters. Thank you for that presentation. Although I understand you're trying to get a rehab facility going, I believe that is the right way to go. We need to try to create a facility that's going to be meaningful to the people. One facility I know of is in Phoenix, where they have a 6-month program and a 3-month program, and that should be something we need to look at. I can't exactly remember the name of the facility now, but it's in Phoenix, and it lodges over 150 individuals. But they have several projects for them to work on, and they go around the city and work on in the places where they do donations. and give them jobs and something to do. Some kind of rehab program like that would be needed here on the reservation. That's one thing I want to stress, is that we need some sort of rehab nearby. The other thing would be, how many years have you guys been on 638 now? And how many years is, I don't have the legislation in front of me. I was trying to see, look at it, but how many years are you requesting on this approval here for the extension of the 638? How many years are we looking at? Vice Chair?
Thank you, Delegate Lona. I'll hand it back over to FDIHB.
Thank you for that question, Delegate Lona and Delegate Slater. As far as the rehab facility goes, you know, it's definitely a need for the communities in Fort Defiance and the surrounding areas. It's been a topic that's been discussed pretty heavily. However, the information that we are going to create one is inaccurate. At this time, we have no plans to open one. We performed a sustainability study. Unfortunately, we don't have the resources to implement a rehab facility in the local area. And until we reach a level of sustainability for that kind of resource, you know, we'll continue to be sure that members of our community are treated at the best facilities possible within reach of their family. You know, one of the things that we often talk about are the social ills that contribute to a person's health care, and most definitely alcoholism is one of those, one of the many facets that kind of cripples a community's health care. And we definitely recognize that, and we definitely want to make sure that we reinforce the methods that we have to treat those ailments. And until we reach a level of resource that's capable of handling a local rehabilitation facility, we'll continue to treat those patients, send those patients for treatment to Phoenix area. You know, there are some options. I know in terms of close proximity to the reservation, Rehoboth McKinley County Hospital recently had a rehabilitation services program, and they closed their doors recently because the non-availability of resources, their ability to keep it staffed and keep their doors open has been disabled due to you know, all the many social pressures that have caused hospitals to shut down their services. Fort Defiance has been fortunate to not decrease the number of services they've had, but hospitals like RMCH have. But now they have a vacant rehabilitation facility for alcohol that the Navajo Nation could consider purchasing and staffing with possibly ARPA funds. And you know, we most definitely would be able to endorse that purchase or that use by the Navajo Nation to RMCH. And you know, we're pretty confident that RMCH would be interested in making sure that service is reinstated, and most definitely we'd be willing to offer our expertise in making sure that becomes effectuated.
So if I could speak, Mr. Tom, thank you, Delegate Slater and Delegate Halona, for the questions. We have been a 638 facility for 11 years now, and we've had a variety of number of years of reauthorization. Our most recent, the term that we're on right now, the contract we're on right now, is a 3-year. Prior to that, I believe we had a 5-year, and I can't remember, that was before my time. So this time we are seeking a 15-year reauthorization. And again, that is more in line for us to be able to do long-term growth and development. When you only have 3 years, you really just don't have the time to build something like the size of our wellness center in 3 years' time. Between, designing, planning, putting it out for RFP, and then actual construction, you run up against the end of the 638 contract time, and we don't want to run out of money, run out of reauthorization, run out of contract. And I wouldn't want to start something if we weren't sure we had the number of years in our pocket to finish it. So hence the reason we're seeking that number of years. That just allows us to do more growth and development. I hope that answers your question, sir.
Oh. Thank you. Yes,
so Lorna, do you have a follow-up?
Just a quick comment. Thank you for that. Now I understand what the process was with Fortified Hospital. And yeah, most of our hospitals that were doing 638, they're coming up with the same deal, is that they can't do financing when they try to go do a bank loan or some sort of a project that they're getting into, and they need a longer time frame. And that's what the banks are looking at, basically, yes. I guess, the lenders. So
yes, I
do agree that a little bit longer would be more favorable, give you a little bit more options. Thank you.
Thank you, sir.
Thank you very much. Committee members, session is still open. Well, committee members, I'm going to ask you this. I'm currently chairing the meeting, but I'd like to ask, oh, actually, I just got a message. It looks like we have Delegate Wilson Stewart on the line, so I'm going to recognize him. This is his district. Delegate Stewart.
Yes, good morning, Vice Chair Slater and HESI committee members. Sounds like Dr. Arantino and Mr. Tom are online as well, and also Mr. Dempsey I see as well. Good morning, and thank you for the invite on this work session for this morning. Knowing that Delta Medical Center is a part of the community that I serve and represent, and I've always been a good advocate for them, especially with my communication with Dr. Arantino and Mr. Tom and Mr. Dempsey. The questions I have, Mr. Slater, to Dr. Arantino and Mr. Tom are the board's terms. How long are those terms for? The reason why I ask this is because in the past, there has been the board that has come to the 4 chapters, and these representatives from the chapter, they come and they ask for reauthorization. The community members have asked them to come back on a monthly basis to provide a report. Mr. Dempsey does come, yes, which is very informative. And also Mr. Clichy as well, as far as the updates go, and updates that I receive via email. But my concern is with the board. If they can't commit to making an attempt to attend the meetings, then I believe they need to be replaced, because they give their word that they're going to be there. And to me, that's a reflection on the hospital. You can't be there to commit to these chapter meetings and these planning meetings, then why even go? Why even ask for reauthorization on behalf of the chapters or on behalf of the hospital from the chapters? Because these are things that they ask for. Hold on, Vice Chair Slater. So with that in mind, and then 11 years of being at 638 and knowing the improvements are there with the wellness center, with the fast track, and also with the minor improvements. How is there, looking at all these now and then going through this year of pandemic, what is the rate of keeping our doctors and nurses on more for a longer term, rather than just having them for 6 months, I believe it was, and then leaving? That's my other question I have. So the board term, and then also the services from the doctors and nurses to stay longer. That's what I have. Thank you, Vice Chair Slater.
Fort Defiance Indian Health Board, you're recognized for your response. Thank you.
Thank you for that question, Delegate Stewart. Currently, the board terms are staggered 4-year terms. Right now, due to the pandemic, those terms are frozen. And then also in conjunction with the conversion of the management positions into permanent positions, those terms are frozen, but we'll make sure that that message is reiterated to the board members. You know, there's been a lot of confusion over the past year and a half over meeting attendance rates, so we'll definitely make sure to make ourselves available to attend the various meetings, not just at Fort Defiance, but at meetings throughout the 16 chapters. Oh, in terms of the turnaround, Delegate Stewart, is it 3 to 5 years?
Yes, 3 to 5 years for our physicians. Typically, they stay on 3 to 5 years.
So there's a 3 to 5 year range that the doctors and physicians usually stay here before you know, they move on or get reassigned to a different area. You know, one of the things that we definitely have noticed in some of the exit interviews for these facilities, somebody coming to serve our communities that's not from here, you know, I hate to make this distinction, but a majority of non-Navajo providers who come here expecting to deliver healthcare to our community members, when they discover that they can't own land here, when they can't make a permanent establishment as to where they live, when they realize the education system options are limited, you know, they most definitely start to look elsewhere, to be quite honest. And the community members, unfortunately, bear the brunt of it, as physicians and nurses often find more permanent establishments to work for, which leaves their patients here in sort of disarray and leaves us scrambling to find additional providers. However, you know, there are rare individuals like Dr. Atkins. We've been fortunate. There are a number of physicians and dentists and healthcare providers who mirror her commitment to our people, have been here more than 20 years. And we most definitely do our best to make sure that we provide recognition and commitment to making sure that they stick around. So, you know, we have heard some folks bring the concern to us about the longevity of the physicians, and we definitely want to reiterate that this isn't a localized issue. On the 638 meetings, this is a echo across the board for Tuba City, Winslow, Utah Navajo Health Systems. There are very few non-Navajo physicians who come and stick around, and you know, we definitely recognize that across the board. So thank you for that question.
Delegate Stewart, do you have a follow-up?
Yes, Vice Chair Slater. Again, thank you for the time. And Mr. Tom and Dr. Atkins, I just got your text message. Thank you for that correction. Or Arantino. And thank you for the response, Mr. Tom. And as well, I do understand, within this past year, but, these reauthorizations came about when the chapters were starting to reopen. And, I did make the comment directly to the board as well during the chapter meetings that I attend. And so it's in the meeting minutes in there for the surrounding chapters, the Crystal chapter, Red Lake. And I don't think they went to Sawmill. I wasn't there. I didn't hear it, rather. I was there, but I didn't hear anything on that one. And also with Fort Defiance, but that was something I want to ask about because, when you and Mr. Tom are aware that when you come to the community here in Fort, and once the community hears board member, they run to you. And I was one of those that ran to you at that time to say, these are the concerns from the community. And so that's why I'm asking, if they're going to be there, then they need to be there. And they need to know what the hospital is doing and also report back. I've been very fortunate to attend a couple of the board meetings there at the hospital as well before the pandemic and to kind of get an understanding. I was still learning, but then I went into this other role as a delegate. But that was my role as a chapter president when I was there. Was I went in and I saw what was happening, and what were the situations then? What were the plans then? Then into this new role, I haven't gone back there as well to participate or even be part of those meetings, but it was very interesting at the time for me. And so that's why I'm asking, if they're going to be in that role, then they need to report that back to the community and say, this is what we as a board are doing. This is what our goals are, instead of just saying, oh, we're here for reauthorization and we see them every 3 years. But that's what I want to, that's why I'm asking these questions to you, Mr. Tom, and also Arantino, because I do see Mr. Dempsey, I do see Mr. Clichy out there. They do provide me with information I need, and other staff as well. They're very willing, and Dr. Arantino has asked what areas she can assist in as well. And I appreciate that, as a community leader, and that way when I get asked these questions, although, I give them the best information I can, and I let them know this is just what I've been informed and this is what I can say. And, I do appreciate that as well. So that's the end of my comment right now, Slater, Vice Chair Slater, sorry. Thank you.
Vice Chair Slater?
Yes, you're recognized. Is that Mr. Tom?
Yes, sir. I also do want to reiterate, in terms of there are a very limited number of Navajo physicians throughout the country, but at Fort Defiance, we're proud to have a majority of them at Fort Defiance. And, we in terms of, the most literal you can get with homegrown physicians, we have the most here at Fort Defiance. And it's definitely a statistic that's envied by other hospitals. We have, folks from the Fort Defiance community who were born and grew up here. We have our Chief Medical Officer, Dr. Tutt, who was born and raised on the Navajo Reservation, who, know all the social constructs, environment that their patients grow up in, and therefore are able to relate even more so. And, we're proud of the statistic that we're able to host a majority of the Navajo physicians that are available in this country at our facility. Thank you.
Thank you very much. Committee members, the delegates on the line, floor is still open. Committee members, I'll ask for your guidance. I would like to ask a few questions. So would you like me to appoint a chair pro tem?
Oh, you don't have to.
Okay. Yeah, we're not debating this legislation at the time, so I'm going to ask a few questions. So, I guess I have a couple asks prior to next week, or I'm actually not sure we'll be considering this legislation next week. It might be 2 weeks from now. Could you forward me, I guess, your most recent audits, and then also forward them to the Department of Health? I'm pretty sure that's already a standard practice, but I want to make sure that it is. I don't think that's in the legislation right now. I'm having difficulty with my internet downloading documents, but that's an ask right now to send me audits. I think, hey, Delegate Halona, you just make sure you're on mute. Thank you. Second, I've had some constituents who work at the hospital contact me and say that they're fearful of retribution, they're fearful of speaking out and sharing their experiences about their work environment and how personnel matters are handled at the hospital. And some of it relates to a particular incident with someone, and I think we'd go into executive session to discuss it, but it was the hospital's handling of that particular matter and the safety of the women at the hospital that is deeply concerning. And I think, you know, a lot of work environments say, oh, I'm fearful of retribution and this or that. And in this committee's experience, when we have been presented with people, you know, folks who make that claim, almost universally, either they or other people within the organization have received some sort of adverse action from within the organization. So it concerns me because those are only people who kind of reached out through other channels. And it's just kind of peculiar. It's something that starts to raise the alarm where no one else within an organization is willing to speak with leadership, you know, even just off the record, a casual conversation, things like that. And that is not something that you can put down, you know, really concretely on paper. It's anecdotal. It's based off of conversations I've had, experiences I've had. But this is going to lead into a question that I'll have. And what do you think are your greatest weaknesses right now, and the places where you need to make the greatest improvement on behalf of the organization and the citizens that you serve of the Navajo Nation? So we'll start there.
Thank you, Delegate Slater. That question that you just asked, are you asking that in terms of the concern that was brought up by the community member?
It's really, I'll circle back to that, but later. This is more general to the organization, saying what is your greatest weaknesses and where would you like to increase your performance the greatest?
Right now, it feels like, particularly, you know, coming out of the pandemic, and some of this may just feel like uncertainty from the pandemic, but from my standpoint, instability and uncertainty about where our funding may come from, whether we're going to exist in the next several years, and in light of the pandemic, and I'm sure many communities felt this and other hospitals felt this, but uncertainty about guaranteeing that we have adequate supply chains and that we can get the PPE that we need. Right now, we're fine. Right now, we're really good, but there were many months where it was day to day, and we were sewing gowns and we were sewing hats and masks in our wellness center, you know, just to get by. That was pretty scary and devastating. I don't ever want to put our providers through that again. So that instability, to me, feels like a huge weakness. I feel like our recruiting does really well. We're able to recruit providers pretty well. Right now, we've got a lack of nurses, but what I'm seeing as a trend, and I'm hearing it in a variety of venues, is there are people leaving the medical field in droves. And I feel it too as a provider myself that, it's so hard after the pandemic, and it was so devastating. I think that so many people feel like, boy, I just don't know that I have the energy or the heart or the whatever to go through it again, and knowing that the Delta variant is potentially out there. That feels unstable or uncertain to me as well. So it's not that we have a hard time recruiting, but I think overall just finding the number, adequate number of providers and nurses and medical professionals out there in this country is one of our greatest weaknesses. It's just going to be very hard for us over the next couple years until we can get people through school and through training and begin to increase those numbers throughout the country. That's incredibly difficult, and it's hard to wrap our heads around. So what that means is a lot of creative thinking on our part about how we can see patients and still provide adequate care, whether that means, some hybridization of telehealth or, some in-person visits, some mobile health visits, some, telehealth. I don't know. That, to me, feels like our greatest weakness. Our strength is that our employees and our community and our board members just continue to be committed and go. And I've said this story, and people are probably tired of hearing it, but one of the examples is when we got the batch of vaccines, one of our first vaccine events. Remember, we got the vaccine mid to late December, and we were able to vaccinate some of our high-risk healthcare workers, our ER docs, our ER nurses, the folks on our inpatient units. We had to keep them protected because they were the ones dealing with face-to-face with our COVID patients. But then we were ready to roll it out to the community. And it was like January 20th, 23rd, and it was a Sunday, and it was 9 degrees. And I was up at 5 in the morning driving out from my house in Gallup, and we had our first large-scale vaccine event planned. And as I was driving out, I thought, I'm going to be the only person out here. It is 9 degrees. There is no way any of the 250 employees that agreed to work this event are going to show up today. I'm going to be the only person here. And I got out here, and every one of them was here. Everybody was here, and they had smiles on their faces, and they were excited to finally roll this ray of hope out to our community. We had board members there. We had executive team members there. We had people that weren't even in medical positions that were out there helping us. Our maintenance guys, our housekeeping, our IT folks, everybody was out there just doing their part. So I think our commitment, and it's constant. And I see that among our community members, and I think it's just something that's so endemic to people here in our community that they'll keep going and they'll keep trying, and they have resilience, and they keep working towards something better for their families, for themselves, and for their community members. To me, that is the biggest thing, and that's what I scream from the rooftops that, to anybody that'll listen is, you think what you want about how small our hospital is, but we are committed and we're resilient and we keep going and we don't give up. That I don't know, Mr. Tom, if you feel different from the board point of view about strengths and weaknesses.
Thank you, Dr. Atkins. No, I'm in agreement. One of the things that's interesting, as you all know, from a leadership perspective, is the level of criticism that we receive from all different avenues of society. One of the, I believe it was maybe a while ago, the Gallup Independent submitted a story that made front page news that alleged Fort Defiance was providing triage care in the parking lot of our facility. And, that report, of course, was inaccurate, yet the reporter didn't issue a correction statement. However, you know, that was an attempt to blemish our record, you know, Fort Defiance is providing triage care in the parking lot. Well, that same parking lot that was used to provide a smear on the services that we provide is the same parking lot where we witnessed the miracle of hope come into fruition. You know, it was each of the board members were tasked with making sure that they worked some of the shifts as parking guides or timers. You know, we made sure that the board members were involved, and we witnessed firsthand, you know, people in tears after receiving the vaccine in our parking lot. You know, after almost a year of being in a very dark space, for us to see that light start to shine in our parking lot with these folks who waited hours to get a vaccine was a miracle in and of itself. You know, I think for us, if you ask me the strength of the hospital from a board perspective, my money is always going to be on the people that work here. You know, one of the things that the culture shifts that I worked very hard, and the board and I worked very hard, is to remove sort of the dignitary connotation of being a board member. You know, we yield the expertise to Dr. Atkins and her team. You know, we try and make it so that we're merely advisors to a group of experts. And, you know, from that seat, we've witnessed that the people that work at our facility are always going to be the heart and soul of Fort Defiance Indian Hospital Board. And we've always done our best to make sure that recognition is received or distributed evenly among all the workers. And again, you know, just to reiterate the weakness is always going to be the factors that we can't control. Is there going to be a resurgence in the pandemic? Is it going to gain new ground? How is it going to affect the people that are unvaccinated? If in the event that the variant runs rampant in those who aren't vaccinated, are we going to have the supply chain to make sure that we have? But then again, you know, as Dr. Atkins mentioned, if we come up short in the supply chain for providing PPE, the people of this organization have always been the ones to step up and provide what's needed. You know, we're not very good at sit and wait. We're very, okay, we need this, let's figure out how to get it ASAP. And we definitely revere in the proactive nature of our staff, and we're appreciative that we get to work with these folks and provide advice to them on a daily basis. So that's all I have to say. Thank you, Vice Chair Slater.
Thank you. Did the hospital, or was the hospital able to provide hazard pay to their frontline staff?
Delegate Slater, this is Dr. Atkins. No, we did not provide hazard pay. At the time, we weren't sure, because we had no patient revenue coming in other than our ER and our inpatient units. Our revenue decreased significantly. We didn't want to begin doing any hazard pay because we didn't know that we could sustain it. We hated to pay people hazard pay now, but not let them, you know, not be able to afford funding their position and keeping them on board 6 months down the road. And how do you decide who's in the most hazardous, in the greatest line of fire? I felt like everybody was doing their part, and I couldn't necessarily say these folks are, you know, in greater danger than these other folks, because that minimizes all of the hard work that the non-medical providers were doing as well. You know, we had people scattered all over the hospital doing things that were never in their position description, but everybody stepped up and did that. So I didn't think morale-wise it was a good move. What we did not do at all is lay anyone off or decrease anyone's pay or decrease anyone's hours. We kept everyone's pay the exact same place it was prior to the pandemic. No one got laid off. No one had to decrease their hours at all. We never asked anyone to do that. And that was the absolute last thing I ever wanted to do, because we have over 1,000 employees here. So many of our employees are community members, and I did not want to put any of those people in a financial hardship. That was the greater concern for me.
Thank you. So you said you have over 1,000. Is it about 1,000, or is it substantially higher?
It's over 1,000, sir.
Okay. Yeah, I mean, I think back to what the nation is confronting right now, you know, we've received ARPA monies, and we have to look at how to spend them. Premium pay for folks who bear and will bear the most risk to their health and well-being are people we need to contemplate supporting. So that's why I asked that. What supplemental funding has the hospital received from the CARES Act or that CARES 2 type bill, and then also under ARPA from IHS or from other sources?
Delegate Slater, may I ask Margaret Lynch, she's our Executive Vice President of Corporate Operations, to chime in on that, because she oversees the finance division and she can name each of those for you in detail.
Yes, Delegate Slater and honorable committee members. She Margaret Lynch, Nakaidane Inchle, Tlizaslani Bashuchin. I serve and have the honor to serve as the Executive Vice President of Corporate Operations for Fort Defiance Indian Hospital. During the pandemic, FDIHB did submit various applications for various grants that were offered throughout the pandemic. And I think currently we have roughly about 15 individual grants. Some of them range from around $250,000 to like $800,000, and they are specific to areas of need, like telehealth, or just combating the virus itself, or contact tracing. So most of those grants have specific parameters. We did receive funds directly through Indian Health Service from the CARES Act in approximately $13.2 million, which was directly applied to operations and to FDIHB salaries. As Dr. Atkins mentioned earlier, we were one of the few 638 facilities that did not have to decrease pay at all, or to lay off any employees, or to decrease any of our benefits. And it was the CARES Act money that helped us stay afloat, because our revenue was not coming in. All of our outpatient services, as the committee knows, were closed just because of the huge risk of spreading the virus and infection, not only to employees but to patients. So we do have several grants that we are still currently working with, and then of course the money that we received through the CARES Act. I hope, sir, that answers your question.
Thank you. So what is the financial picture now? You mentioned that there's been a decline in patient revenue. So what is the facility looking at? What is the organization looking at?
Thank you for that question, Delegate Slater. Unfortunately, we're not out of the woods yet. Every year, our finance team puts together a revenue projection goal for each fiscal year. And it's an involved calculation, but it's based on historical data, financial data. Last year, our collection goal for FY '20 was at 93 million. FDIHB did not meet that collection goal. Like I said earlier, the little over 13 million that we received in CARES Act funds helped offset that. This year, we again will not be meeting our revenue collection projections simply because, you know, we've had to open up our outpatient services slowly to make sure that everyone is being safe and we're taking every precaution. Right now, we're looking at a projection of collecting 85 million, but our revenue projection goal was 93. So we are going to be short again this year. And that's what we're looking at. So as we go into the budgeting season, which we're in right now, sir, we are looking at being conservative in those areas that do not impact direct patient care. So as we move forward with our budget process, that's what we will be looking at. We have decreased our revenue projection for FY22, and we're looking at a little over 90 million in collection.
So when you see declines in patient revenue, how does that affect the operations of the hospital and patient care?
The decrease in revenue, this is Dr. Adkins, Delegate Slater. The decrease in revenue is, you know, certainly impactful on our overall bottom line, but as things slowly begin to open, we hope to see that increase. Most of our clinics are open almost 100%. Again, as Margaret mentioned, that we have to keep some space between appointments because we need to go through and clean the rooms in a much deeper manner than we were doing before. So appointment times are, or the time between appointments is much longer than it was before. It should not impact in any way our salaries. The money that we receive from IHS or through IHS from the federal government covers our salaries. So that part is adequate. And as Margaret said, we are just going to be very cautious and conservative with what our budget looks like next year. So we'll limit any type of online training that people are able to do because many of the continuing education programs that our physicians need, instead of being in person, not every one of them has gone back to an in-person platform. Many of those are still online. So we'll encourage our providers to utilize online rather than utilize travel funds. That's just an example of where we'll be conservative. We'll also limit construction projects. You know, sometimes things are, and some of our construction projects are not necessarily needed because something is broken or needs to be replaced. Sometimes it's just, you know, let's modify this room and change out the cabinetry and bring it more up to date. We'll pause on that as well, just so we're really focusing on the critical needs. And Margaret, did you want to add any additional areas that we were going to limit?
So one of our main focus here is going to be on ensuring that we can provide direct patient care. So other areas like travel, professional development, those will be limited. We have other things that we use to budget for, like employee events and those kind of things. Those things will be hugely limited, not just because of the financial aspect, although that is critical, but it's also because of the safety of our employees and social distancing and mask wearing and all of those things. Fort Defiance does have a policy that we follow in emergency situations for contingency, for funding, and how do we address that, and what areas do we take a step back on, and it is never direct patient care. We'll stop spending in other areas just to make sure that we can pay our employees to provide the best care to our community members.
Does that conclude the response?
Yes,
Yes,
sir.
sir.
Okay. So my next question is, we had a report from Rosalind So yesterday, and she was talking about how she is, I should probably go back and look exactly how she phrased it in my notes, but is seeking the sort of continuous improvement of the Navajo area IHS, and is trying to produce a higher level of quality for the patients and the overall organization. And I think that that's something that's really important to the committee and to Navajo Nation leadership, is that every entity that takes on the designation of a tribal organization seeks that continuous improvement and leveling up of their capabilities, and that we don't become complacent in the processes that we have and the management that we have. You know, it's always going to be a mixed bag. Everybody isn't going to have the same experience as an employee. You're going to have employees who absolutely love working where they are. You're going to have employees who have the greatest contempt for their management, whether it's warranted or not. But what the hospital can control to a great extent, and what the facility and the organization can control, is that level of care. And the only way to really, I would say, stay at a high level is to constantly seek improvement. And it's not just because factors are always changing in how you provide healthcare, but it's because it creates a disciplined environment that compels people to be the best at every moment that they have. And that's what our Navajo people deserve. That's what they really, really deserve. I think that maybe not in this organization, maybe in this organization, but it's certainly the case with 638 entities in general across the Navajo Nation, that there's a level of complacency, and it's almost like rent-seeking behavior, where you have your money and you're just trying to maximize either the profit from it or the I don't know. Sometimes it's just doing as little as possible with what you have, so you don't have to spend too much money. I'm not accusing you of that, but I'm saying that that is a feature, and I think it's a part of the economics of reservations and our government system, whether it's school boards or other entities. So please be mindful and just constantly seek that continuous improvement. You know, I've heard positive things from people in all aspects of this organization. I've heard some, you know, very critical things, and we'll pivot to one of those in a moment. But that's my sincere ask. So next question that I have is, this committee and the nation is considering compacting and contracting the Navajo area IHS system. I think some of the most innovative, progressive, and then highest levels of improvement in Indian healthcare are coming from Alaska and Oklahoma, where they have pulled off this feat and are implementing it. And I'd like to hear from management what they think about that deployment on the Navajo Nation and what that vision may be, including FDIHB. So that's my next question. Thank you.
Thank you, Delegate Slater. I think that having worked in other organizations that were federal, my early part of my career, I was in federal organizations on Navajo, and then was again at this hospital, excuse me, Fort Defiance Hospital, when we were still federal, and then shifting gears into a 638 framework. It's like night and day. And I would love to see the rest of the hospitals on Navajo do that. Just to share my big dream vision and goals, how it would look like. If we could do it, it would be fantastic if all of the hospitals on Navajo were 638. And think about what Mr. Tom mentioned earlier, RMCH in Gallup is struggling right now. If there was 638 purchasing power in place with GIMC and us, we could buy some of those facilities or those branches that RMCH isn't able to support anymore. And then we could ensure that our Navajo people are cared for and kept in Gallup or in local areas as best as possible, rather than sending people to Albuquerque or Phoenix or Flagstaff. You know, that would be my big dream vision, is if RMCH can't support itself, wouldn't it be great if we could all do it? And we had the input of several of the 638 hospitals around the entire Navajo reservation. Again, big dream, but I don't think it's a bad idea. And look at what we've been able to do when we've gone 638. We were able to receive settlement funding from the lawsuit that IHS settled with many of the facilities on Navajo. We directly put that money into a wellness center, and within like 2 years, we had that wellness center built. I don't know that that's even heard of in a federal facility, of anything happening that fast. So I think the things that can happen and the changes and the expansion that can be had in a 638 program, they're far and above the federal setting. And it's not that the folks in the federal settings are doing a bad job or aren't working hard. They just have constraints. And it would be great if we could just take the bull by the horns and just do it better. And you are absolutely right. You know, every Navajo person, everybody here deserves to have the best quality care. And I have always approached it from the standpoint of, you know, if I fall down and I have a heart attack in this hospital, this team better be good, because they're going to be the ones taking care of me too. So it's not, I always think of it in the framework of how would I want my family, my mom and dad treated, my son treated. And that's what I'm aiming for here. And I think we would have more control over that if all hospitals were 638. That's just my opinion. Mr. Tom, do you feel different? Or
Dr. Alfred's on too.
Oh, okay.
No, I agree. I think, you know, thank you, Delegate Slater, for that question. From a continuous improvement standpoint, you know, I think I'm very proud to say that I think as a board, we've sort of created this recognition and spread it throughout the board and throughout the administration, that, you know, there's always definitely room for improvement. But one of the things as board members we'd like to do moving forward is work with, you know, we can be the instrument by which we work with Navajo Nation Council, work with our local chapters to help them come to the understanding that the hospital is essentially the last line of defense for a person's health. You know, we want to make sure that that understanding comes across very clear. By the time that an individual gets to us, you know, we're already behind the curve, so to speak. You know, we want to make sure that while the facility is ready to handle anything and everything that comes at it, we want to be sure that there's a lot of work being done behind the scenes to prevent people from coming to the hospital. That was essentially one of the main motivations for the Wellness Center, to make sure that we have a proactive upstream approach to providing health care. And we want to present that model to Navajo Nation Council and to members of the local chapters as well, to make sure that, you know, we encourage them to build the health campaigns into their policies and procedures as well, to make sure that, you know, everybody's doing everything. You know, healthcare is an all hands on deck situation, and it's not something that's siloed to the healthcare organizations throughout the reservation. You know, there's not a magic formula that Rosalind So could follow, that Dr. Atkins can follow. It needs to be a formula that's implemented by Rosalind So, Dr. Atkins, Delegate Slater, Delegate Halona, Jonathan Nez, and Dr. Jill Jim. You know, all those folks speaking in one voice to make sure that, you know, we take care of our own is definitely going to be one of the first steps. So we thank you for that, and we want to make sure that we iterate that that's one of our primary concerns.
Okay, I'll have one final recommendation, and then I'm going to ask my final question. So the recommendation would be, it would reflect very well on the board and the organization to continue or to work with the local chapters to develop proposals that will support, a stronger community and confront the inequities within our communities with respect to the social determinants of health. I think you read the interim final rule under ARPA and the money that's come to the Navajo Nation, the Fiscal Relief Fund. That is something that we can address with the money that's come in. And I really think it would reflect well if, you could take your data on your service area and say, this is what we see. These are the facilities we have, the wellness center, et cetera, but there's a gap here. We need like a walking trail there, or we need, this type of facility here, or, this sort of programming. We could test it out for 2 years to address X issue within the community. And partner with the chapters to help empower them in doing that. So that's one. Second, I think that it'd be irresponsible for the committee not to address this issue, but, what's been conveyed to me, and I didn't know this until the reauthorization, was that there was an IT tech who had placed cameras in women's bathrooms. And I want to know what you can convey on the record. I know it's in litigation right now, but what needs to be conveyed to the public about how the organization is confronting that. And then from a personal policies, perspective, it's really important that there's a commitment to the Navajo people and to the Navajo Nation that this is being addressed, that the inadequacies that may have led to what allegedly took place are being addressed. So thank you. That's what I'm going to ask.
Thank you, Delegate Slater. I could speak about that camera issue. I was involved in the investigation and the management of it from the very beginning. In terms of what we're doing to prevent it, we worked very, very closely with the FBI. We brought them in from the beginning with this investigation and worked very closely with them. Unfortunately, the one thing they did say, because we asked the exact question you just did, what could we have done to prevent that? How can we stop this? How can we stop anybody from ever doing this again in the future? And unfortunately, there's not much we can do. People will be nefarious. Criminals are criminals. So our best bet is to be as proactive as possible and to watch for any activity that may indicate that something nefarious is happening, that something illegal is happening. One of the things we're doing is doing, absolute 100% background checks on every employee. The law that we follow, the Indian Child Protection Act, says that we need to do them on people that have contact with Indian children. We took that a step further. We said absolutely every person must pass that, whether you work in IT, you are a pediatrician, or you are a security guard. Every single person must pass that background check before we hire you. And we do routine rechecks every 5 years. If an on-staff employee, somebody who's on board currently, does not pass that, when we do the recheck, then we deal with that person in real time. As you said, this is in litigation, so there's not many details I can speak of beyond that. But I can tell you, as one of the victims of that crime, and I'm okay saying it, I won't say who else, anyone else, any of the other victims' identities are, but I can tell you from the standpoint of one of the victims that I've worked very hard to ensure that nobody else has to go through this, has to go through what I went through and what any of the other fellow victims went through. So we took this very seriously and did not take it lightly. It was quite devastating and painful. So we don't talk very openly about it with a lot of people because it just dredges up some pretty painful feelings and experiences for all of us victims. But Margaret, did you want to speak to the background checks at all?
Yes, I'd like to, Delegate Slater, speak to the in-depthness of the background checks that FDIHB does. It's not just a regular background check that, checks your license and your employment history, but it's also a character background investigation that aligns with the Indian Child Protection and Family Violence Prevention Act, which is Public Law 101-630. That is an in-depth background check into not only criminal activity, it includes an FBI fingerprint search, but also the character of the individuals FDIHB is hiring. We do that on all our newly hired employees, and then conduct it on a regular basis every 5 years. Now, that being said, if issues or concerns arise, then an investigation is done again, a background check is done again, just to ensure that we're making sure that not only our patients are safe, but that our employees are as well. The other thing that FDIHB did immediately after this was we established a separate IT security department and have an individual that is very well known in this particular profession that oversees that department and monitors that daily, just to make sure that we're keeping our employees safe. I too will just let you know that I was also a victim of this crime. I also am an enrolled member of the Navajo Nation and a lifelong community member. My little brother was born at the old hospital in Fort Defiance. And this is where I go to get my health care. This is where I've brought my children. This is where my parents went to get their health care. And it's hugely important to me that we maintain a level of security. Dr. Atkins is correct in that we did ask the FBI what potentially could we have done. And the reality is that, as Dr. Atkins says, criminals are criminals, and they're going to find a way around the safeguards no matter what you do. So we do our due diligence and make sure that we provide every safeguard that we possibly can. The thing I'd also like to mention, Delegate Slater, that I think is hugely important, without the cooperation of FDIHB and the manner in which it was handled, this individual would not now be sitting in a federal prison, but he is, because we cooperated fully with the FBI and provided them everything that they needed to make sure that this individual went to jail for this crime. And I just want to assure you that as victims, Dr. Atkins and I, we do not and did not take this lightly. Thank you, sir.
In addition to that, Delegate Slater, we ensured that all avenues were explored to make sure that he didn't go to another local hospital in the area. And so we made sure all those pathways were cut off. This background check that Dr. Atkins and Ms. Lynch allude to or mention is not a new process, and we've definitely been doing it for a while. It's also a process that kind of limits the eligibility of board participants for the hospital. The board members are apprised to the same background check, stringent background check, as the employees. And unfortunately, a couple of times it's warranted the termination of a couple of applicants from that pool because of this background check. One of the things that we did discover throughout this camera incident, Delegate Slater, it's a very unfortunate one, and it's one that we could probably use your assistance. We have spoke with Delegate Amber Crotty. Unfortunately, we lost steam due to the pandemic in making sure that this process was more formally evaluated. I'm sure you're aware of this, but it's not allowed for a Navajo member to press charges against another Navajo for this kind of crime. The individual, only non-Navajo members can press charges against the Navajo criminal in this scenario. So our Navajo employees weren't offered the same ability to press charges as our non-Navajo employees who were victims in this incident. That's definitely a law that's one-sided. It definitely needs to change on the Navajo reservation, and we hope that, you know, we can work with you and other Navajo Nation delegates to make sure that this Navajo on Navajo crime is punishable. You know, we definitely want to make sure that that process exists, and so that there's some hope for our Navajo employees that if this were to happen somewhere else on the reservation, there's legal avenues that will put them at ease to make sure that they get some retribution for on behalf of crimes that were committed against them. So we could really use your assistance and guidance to make sure that that law changes on our reservation.
Thank you very much for the response. So I think Dr. Jim on the line. Looks like she is. We definitely ask her for support and questions and her, you know, leadership and analysis when we consider these reauthorization proposals. And so I think what I'm going to ask right now is that Dr. Jim preview a series of questions about quality of care, and then ask that the leadership respond in writing back to the committee and the department. And it will be something that we can attach to the legislation as an exhibit and be included as this moves through the legislative process. And so with that, I'll hand this over to Dr. Jim, and I think most likely at that point, after Dr. Jim has concluded her remarks and questions, then we'll be ready to take a motion in a second from my colleagues and then proceed to a vote on this agenda item. So Dr. Jim, if you're here and able to speak, please unmute yourself.
Yes, I'm here, Honorable Slater. This is Dr. Jim.
Would you like to review some of the questions that you had provided to me on wait times, appointments, quality of care type things?
Yeah, I think one thing that as the Navajo Department of Health, thank you for allowing me to speak. Honorable Slater, interim chair, also has committee members, and also Dr. Atkins and members of the Tahoe Medical Center board, and also those on the call as well. I just want to also just recognize the invitation to speak. Thank you for that. Yeah, I did send a series of questions. I know that I've been trying to address some of these quality metrics and include them in some of these resolutions previously and some of the reauthorizations. And I think that there needs to be some sort of feedback, I think, from the healthcare facilities as the Navajo Department of Health oversees the comprehensive healthcare services and ensures that we are serving the Navajo people at the utmost that we can. And I believe that with the reauthorization of going to compact, or I think in the legislation does refer to Title I and Title VI, that the facility is being authorized on behalf of the Navajo Nation to the local community of Fort Defiance Service Unit, and that these were obviously once federally operated. And when we move to a Title I or a Title VI facility, we are able to implement our self-determination and self-governance of the Navajo Nation, and authorizing the communities to serve the best services that they can. And council is approving this so that we receive the best services that we can here. And I think that with that, one thing that I have not seen, and I have tried to include in resolutions, is just the quality of care. And simply just to begin reporting and conveying that to the HES committee as the oversight, and also to the Department of Health on simple things that I can't find on Hospital Compare, which is a database where hospitals report their measures, quality measures, to remain CMS certified. So because of the low numbers, sometimes you don't see that, and there's usually a rating that's given to the health facilities based on the Centers for Medicaid and Medicare Services. And so that rating really is the drives what kind of care is being provided at the facilities. Previously, in my previous work, sometimes these CMS measures or Hospital Compare, hospitals would kind of just disregard that to some extent, indicating that it's either misrepresentative, we don't report all the data on there, it doesn't represent our hospital. So they kind of indicate that it's insignificant to the hospital's performance, and there's measures that they collect internally that is more representative. But I think when you're looking at a federal agency rating a specific hospital on their performance, I think we ought to take it seriously to the extent that we are transparent about how we are performing. As we are still in the pandemic, one thing that crosses my mind in pursuing being a health professional, a public health professional, is that how can we improve care on the Navajo Nation, and what does that mean? So going from a federal facility to a Title I to a Title VI, there's an immediate expectation there is better care, that there is less waiting times, there is less readmissions for or less hospital infections. Patients are happier with the care that they're receiving. There's certain expectations that is already immediately stamped when a facility chooses to become Title I or Title VI, and especially when they go to Title VI to redesign their program any way that they want, and without such much accountability coming back to the nation to report to us that services are better. And I think that's what we want to see, and I want to see in some of these reporting that could be attached, as you mentioned. And there are metrics that are, so my request is that any of the CMS metrics for inpatient and outpatient measures that ought to be reported to CMS on a regular basis could be included, and also how they perform to Arizona and also the national average. And so that's where I'm at as I was looking at the Hospital Compare for patient survey ratings right now for Fort Defiance Hospital. I don't know how updated this information is, and just simply looking at care, because we are here for trying to understand if there is better care. So one example in the survey asks patients who reported that their nurses always communicated well, means only 68%, whereas the national average is 81%, and the Arizona average is 77%. There's another example, patients who reported they always receive help as soon as they wanted, and for TMC is 64%, while the national average is 70%, Arizona is 67%. And then there is another example of patients who reported that the area around their room was always quiet at night, in which we do better, actually 65% compared to 62% for the national average and 57% for the Arizona average. And then one thing that they ask at the end is patients who reported yes, they would definitely recommend the hospital, and only 56% indicated they would recommend the hospital, whereas the national average is 72% and the Arizona average is 69%. So when you're looking at patient responses on their care, I know that under the Indian Health Service, there is a requirement for even customer satisfaction. How are customers receiving their care? And so if we don't have that information here, if you do your internal surveys or you use the HCAPS, which is also particularly this survey that I'm referring to, that we don't really have an idea if the hospital is performing better care, that patients are satisfied and they recommend someone else going there. So there is the HCAPS data, I think, that is here, and then we have metrics for even the patients leaving the emergency department before being seen. So those are just some measures, and also the waiting times are very important. The average time patients spend in the emergency department before leaving from the visit too. Those are measures that we look at as far as hospital capacity. And I think there are other measures like hospital healthcare workers being vaccinated as well. So I just wanted to share some of the measures that I think I would like to recommend for the facilities to report and include in regarding how they're performing and how do they compare to the Arizona and national average, and in regards to how care is being provided. So interim chair, Honorable Slater, that would be sort of the request. There are other things that I did have in mind, such as medical staffing vacancy rates, and we are going to deal with the Delta variant. I hope that it doesn't impact the Navajo Nation, but what have the facilities done in the last year to increase capacity? I did hear that there are challenges financially regarding the hospitals, but I think there are dollars that did come in. And I'm wondering, what did we learn from COVID? What did the facility learn from COVID in regards to improving medical staffing retention and vacancy rates within the hospital, and also better looking at how to work with the Department of Health? I know Dr. Atkins and I had talked about a blanket, not a blanket, but an overall MOU and MOA with the Department of Health and all the programs. So I'm thankful for her conversation and continuing to work with the Department of Health and some of those initiatives. So with that, interim chair, I will hand it back over to you. Thank you.
Thank you very much. So Dr. Jim, I sent over some of the questions to Mr. Tom, and then I think we can follow up via email on getting a formal response back from Board Defiance Indian Health Board to the committee and to the council. And thank you very much for sharing that at this time. Committee members, the chair will entertain a motion to accept the report.
Motion, Juanica.
Second, Delegate McKay.
Okay. Delegate Halona actually just texted me and said that he is heading to the funeral service that he mentioned earlier. We have Delegate Charlene So on the line.
Oh, yeah, this is Delegate So. Thank you for allowing me to. I apologize for getting on the call late. I had some technical difficulties. But today I ask that we allow some time to have Doyle Anderson present, and as well as with Kim Schaefer, on behalf of the Fields Project that has been happening at Whitehorse High School. And I feel like this is a direction where our students will pretty much benefit from greatest, and it pretty much sets a solid foundation while they're in school. And a lot of our scholars at Whitehorse High School, they pretty much found a lot of interest in this program. So even yeshinan presentation hinas at the nation so cool. In this case, she's a Charlene So adult was a candidate not sure no as not that and so but I think Bashing Katchi need to check if you cheat need to another a call yat esik asia the nation that's an agi ado anos shanat aniqua Donald Sonegi, 24th Navajo Nation Council members, ado my HESI committee colleagues. Ako. Other question, Fudinago Doyle Anderson, Bangladesh, us, ako. Other, as you do know, I've been wanting to have a field visit to White Mesa Mill and to Whitehorse High School so that my colleagues would be able to hear the testimony of the students of how they have contributed and how and what they have learned. A lot of these programs pretty much set up that foundation as to where they're going to be leading their lives after high school. It provides a lot of technological experience, and we'll go more into depth with that. But, you know, a lot of students today are pretty much debating the idea if they should go to college, if they should go to technical school, if they should join the military, or whether they go straight into the workforce. And most of our students accumulate student debt by getting student loans. You know, not all of our students will find their passion, and not many will excel in college. Not many will excel because they haven't truly discovered their talent. They haven't truly discovered what they want to do. But this is a force setting stone. Yeah.
I just want to let you know, but before you got on, we were able to add them to the agenda. So they're the new item 5C, and this is just accepting the Fort Defiance Indian Health Board report and the review on legislation 9521. So I don't want you to have to go in and repeat yourself when we get to your presentation at 5C.
I'm so sorry, Chair. Yeah. I apologize.
No worries. I know the service is it's difficult where you are. So committee members, just real quickly, I think, is there any other questions or discussion on this item? Going twice, going 3 times. Mr. Mose, I'm going to call for the vote. Can you please provide a roll call vote?
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr.
Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So. Honorable Charlene So.
I vote in favor.
Honorable Charlene So votes in favor. Honorable S.N.J. Wanika. Green. Honorable S.N.J. Wanika votes green. Vice Chair, we had a vote of 3 in favor, 0 opposed.
Okay, please excuse Delegate Halona from this vote and potentially subsequent ones. He's going to rejoin us after the funeral service. Thank you very much to Fort Defiance Indian Health Board, to Dr. Atkins, to Mr. Tom, and the rest of the board members, and to the rest of the management and leadership over there for the presentation. And the legislation will come back before the committee. We'll be in communication with Dr. Jim and with, of course, the board and the management on answering some of this quality of care questions. Kat, we're going to move on.
Thank you.
Okay, we're going to move on to item 5B, COVID-19 and Delta variant health issues regarding Navajo veterans. This presentation is going to come from Naash, Delegate Keon Begay, and with assistance from Dr. Jill Jim. So, Delegate Begay, are you on the line still?
Naash Keon is here. Can you hear me?
Yes, sir. You are recognized.
Yeah, okay. Before I move forward, I want to know if my chapter secretary treasurer committee from Jackie Begay is online.
Yes, I am. This is Jacqueline Begay.
Okay. Naash, kudo na din da hajin kida sa kudo hatin ado kudo report na kishi o kwaje days but the snippy by plan wise.
Mr. Chair, I'm sorry, Delegate Kealan Begay sounds a little bit muted. If he could maybe move closer to his microphone, it would help.
So
Can you hear me now?
if you can go, yeah, that's a little clearer. I have headphones on, so thank you for
Can you hear me now?
Because yeah, that's definitely much better. Thank you.
Oh, okay. I had to take off my earphone as well. I'm also on the RDC meeting. They're on a legislation that I wanted to make a presentation or a comment on. But Kudo Shadejan Linigi has a situation that she wants to pursue, and being a veteran and helping the veteran is a situation that we're dealing with. The trauma and everything else. Kudo Hospital Township, Kwaki be Betikado, Kudo Sato, Ala Kudon Hibispas, and Linigi, Sato, that's a Yekato, Jato. Other base of the Hatanet, Tehida, the Arden, that's a Sato base of the dot, also that's a Pohanetza. These are the areas that Kudo, Ms. Begay, is wanting to pursue. Coco, I would like to just go ahead and give her the full time for her to introduce herself, explain the request of the purpose of the report, and then if you could allow Ashto HES committee, there may be other veterans that could want to make a statement, a short statement, but with the time limit that we have, I'd like to give them the full time to make their plea with the committee. So, Chairman, the HES committee, I appreciate the time. Kodoshi, that's speaking to
Thank you. Ms. Begay, you're recognized.
My name is Jacqueline Begay. Tatnestan Shaw, Twitch 80 Chain, do Kia Ani da Shinaldo, Hashi da Shiche, and Doug Alandeko Inasha. And you're going to have to bear with me here. I am one of the individuals that are referred to as post-COVID-19 long haulers. I have a hard time breathing. I'm still dealing with it. But thank you for the time, and I'll just get to the gist of things. But I was diagnosed with COVID-19 in November, and I did not have any symptoms until starting January of this year. I started having shortness of breath. I had to be on oxygen and a cough. And through that time, I met a lot of people, which includes veterans, from teens all the way to elderly. And like I said, includes veterans. And I did not know about this long haulers. That's how it's being referred to. But I found out a little bit more on my own after meeting people and what they were experiencing. With me, like I said, it is just hard, difficult breathing and continued coughing. It's really interfered with my life. When I started first getting seen, just like a lot of people that I met at IHS, the doctors did say, again, they did not know much about it. It was just like they did with saying about COVID-19. So I think the husband that we don't know that much about it, but we're learning. Now there's a vaccine. Now they're saying the same thing about post-COVID-19. And what is going on is the same thing. The doctors are saying they don't know much about it. As you heard earlier in one of the presenters, she said, the doctor said the same thing. We don't know that much about it. But what my concern is because there's not much known about it, people do not know exactly, the doctors do not know exactly how to treat it. Some of the symptoms that people are going through, like, ranges from losing hair. I don't feel the same as is what a lot of people are saying because, with this post-COVID. And so losing their hair, like I said, their memory is not good. And the thing that worries about me is with a lot of the veterans. One of the veterans actually did say, he was contemplating suicide. With the veterans, they're already dealing with PTSD, and now they're having to deal with this. And that's just more on top of what they're already dealing with. The elderlies, some people my age, they're in the same situation. So a lot of them, like for me, I just continued to request for service. Now I'm seeing a pulmonologist and cardiologist because once this, COVID, it stays in your body. I don't know, but the continued coughing, the continued shortness of breath, the loss of hair, the loss of memory, it's there, it's real. I had one doctor actually say devastating words to me. He told me that there's nothing that can be done. I understand that, but there always could be something done. So like I said, on my own, I sought treatment, and I'm seeing a pulmonologist, which is dealing with a lot of breathing problems, and that's in Flagstaff and in Mesa. And again, it's the same thing as what found out was there's people who have symptoms that, like that I have. Certain medication will work with them, but it didn't work with me. So finally, we found the right dosage and right medication, and I'm on my way to recovery. But the other thing that was mentioned was it's not known how long it will last. I've met people out in Navajo, Fort Defiance, Ganado, Hard Rock, veterans and non-veterans that are dealing with this. And some of them have had it over a year, some of them a few months like me, but we don't know how long it's going to be. With this, I want to give some of the veterans some time that they're on the line to speak briefly, like I said, what they're dealing with and what they've had to go through. But on this, what we're asking is to have some of the funds, the ARPA funds, come in and establish a post-COVID clinic. It's not reinventing anything. It's just using some of the facilities that were used before to establish having specialists come in, cardiologists, because there's some people whose nerves have been affected by this. They can no longer, they were like one lady, she's a student, she was getting her degree. She can't get online anymore because her nerves have been affected by this. And she stopped going to school. She can't get on a phone. She can't for that long. She's, can't get on her laptop to be on class. It affects her nerves. It gives her, it does something to her body, her head. And she's trying to seek medical help right now. She's on her way to Flagstaff to try and see another specialist as well. So this is just to ask to see if some facility can be established so these specialists can come out. I heard people saying we need to take care of our people ourselves. Yes, we do. We need to take care of our elderly. We need to take care of our veterans. We need to take care of our people ourselves here, mainly because we don't want to keep sending people off the reservation. But, because of the, COVID, it still continues to exist. Now the new variant, and it's costly, especially for our veterans. It's costly traveling back and forth. The veterans hospitals are not fully open again. For me, going weekly to Flagstaff and Mesa for treatment, it's costly. So if we can bring these specialists, I know that some of the IHS already have specialty clinics. The cardiologists already do come out, restarting that and then having clinics here and having our people go there and including counseling as well. The church in Chinle Potter's House buried over 80 people this last year, doing graveyard services, and they're still continuing to do counseling services. People buried their loved ones and, they never said their farewell. They never did a proper funeral. So getting counseling for these people as well. They need help. Our people need help. There's not much is known about this long haulers. I would like to see our Navajo Nation get ahead of at least this COVID in this way. Let's try and get ahead, because it is really painful. It affects your mind, it affects your body, and it's very difficult. But I just wanted to kind of do an introduction, and I have a veteran here. His name is Bill Thomas, and I'll let him speak very briefly, and I'll have him introduce himself.
Hello, this is Billy Thomas from Mini Falls, Arizona. I'm 79 years old, and Vietnam era veteran, and I got affected by this. What they were just saying is, and I went to the hospital on May the 13th. I was admitted. I didn't know an ambulance came to pick me up, and I was in the hospital. There were so many people there that I had to sleep in the waiting room. It was cold, almost froze to death there. 3 nights before they ever gave me room to stay. And after I got out, I wasn't feeling the way I used to be. I had eye problem, not bad, but they told me it's glaucoma. Then it sort of jumped start again, and I couldn't really see. But right now, everything around me, just if I look around, it's just like a fog around me. And it's continuing to build. And I'm seeking help somehow, but the only way I might get some help is to go off the reservation to see specialists, and that costs money, and I'm really not good at travel. It just weakens me. And at my home, I have a veteran house built for me, and I put all the papers into OEH to try to have it hooked up to water and outside sewer. Then after that, I kept waiting. Right now, it's over 7 years now. They don't know when they would get to me. And the way I see it, some people got their water and sewers set up, and mine, I'm pretty close to going blind, and that really makes the problem worse. And it's unsanitary to be blind and feel your way around your house. And I need help somehow to get my water and sewer fixed up fast enough to where I would at least have help there again. And
okay, that was Bill Thomas. What he's trying to say really is he, in order to practice hygiene, he needs water and sewer, and he hasn't received that. The next one is another veteran. He's online. That's Tim Johnson. Tim Johnson.
can you hear me? Yate, what is us?
Oh,
I'm pretty sure you all know who I am. My name is Tim Johnson. I was the former chapter president over here in Hard Rock. Unfortunately, I myself got this COVID way back the beginning of last year. Ado a large, then you see, yard and he does it. Ado, as a veteran, Ado, as an official, it was pretty rough. I have to tell you, it was pretty rough. Ended up on a ventilator, ended up down there in Banner. But the fortunate thing that I'm still here to be able to talk to you is something that is a blessing. But earlier, as Jackie was saying, all those things that she said is exactly right. But if you have a pencil and paper, real quickly, I know we don't have that much time, but draw a circle. Circle na ahayesha. Ado sneo na vertical go hadizo yago. As a traditionalist, did na kitne lago na lon si keson kinata. Ako na yek achites lao yegi aja min chanso sotahadzen. Then what it's the warrior side. Cause yat etolis nada do tati hitishino do natsudon hitantni no don hispausen ha ishite. Akodi it nit as does it I betate it na no bansakis. Akodi eliza whatever data la no ye be caught at the no dat la that e an had it. But the part I wanted to express is this other half on this circle. To complete this wholeness, this whole circle. You don't have to be a traditional. You can be in different denominations, but you know that the spiritual and then the emotional, the physical, the mental part of you, it has to all come together for you to start even to heal. Although with this COVID, some people do ceremony through the phone, but it's not. I wasn't healing now. It seems to me like I wasn't healing. And I think the biggest part of this whole thing is the mental part. This mental part takes a real big effect on you. I'll say it out in public. I said that suicide was there. Hashit to bet that tinta to ya hot ela tit ela to hat ilabani not ela other had na shit na jota in this case. As you know, as a elected official, I'll have to end I got back in there and I tried to do what I can do. I helped. So the hojojic atcha other than Pindo yet to Haki how yet here his ninigi aid a quaggy but and as Jackie said, there's people out there that can help. Why can't we bring those same people here for people? It'll help some people. Other personante could Hoshi na hojojit beyat and is let ninigi to peso panante to but but yeah, she did to the another talk. And need this long hauler is a real thing. That's where I felt like I need to say this. I need to say it. And since there's money floating around out there, a plea to the committee that this needs to happen to help our people, not only the veterans but so the Kwile Hatnina that are recovered. Although to pick it up this asking I'm the acting pro temp central veterans commander. July 30th, this Friday, we're having a meeting over there at Thunderbird Park. Council Delegate Slater, Ellen Key Ellen, if you guys could come then at 12 noon, you guys could come there. I put you guys on the agenda. Otto, Jackie, Nato, And if Dr. Jill Jim's in there, I would like to invite you there. Has all been let those veterans talk about the same issue. And I really appreciate having me the opportunity to give me this time to speak.
Thank you. Hope or Imelda, are you on the line?
Good morning, Jackie.
I'm
Yes,
on the
I
line.
am.
This is Hope. This is Hope.
Okay.
Can you hear me?
Okay, Hope. Yeah, Hope, go ahead. Then we'll have Imelda.
Okay. I know there's a lot of people that needed to speak too, so I'm going to make this kind of short, and I'm on my way to an appointment in Flagstaff. And I just like to, my name is Hope Whitehair, and unfortunately, I was one of the ones that caught COVID back in November as well. And my symptoms were really mild when I had COVID. The whole time I always took one ibuprofen, that was it. But as time went by, 2 weeks later, I started to feel other symptoms. And, weeks, months later to this current day, and I'm still being affected by the symptoms neurologically. And I'm heading to my appointment in Flagstaff right now to a neurologist. And I just, like everyone that spoke, we do need the services here on the reservation. I wish they had, because I get treated as well as, like Jackie said, I get treated in Flagstaff, in Phoenix, and then I travel there like every other week, every month. It's because when I first caught COVID, when the symptoms first started, the doctors didn't know they didn't know what was going on. They didn't know they didn't know they were still doing studies. And that whole time, it took probably about 5 or 6, it was until May that I finally got to see a neurologist appointment. So I was with this symptom, battling this symptom for like 5 to 6 months. And May was my first appointment to a neurologist. And I for 1 month I took for every day for a month I took ibuprofen because of the headaches and migraines. They call it migraine that was happening. And one of the neurologists was like, "Oh my goodness, that's not good. You can't take ibuprofen every day for a whole month." But I said, I had to, because the aches in my head were tremendous, And so, just that being said, to me, it's like we do need those services here on the reservation. And I'm glad that we're out speaking about it, because I know I've talked to other people who have gone through these symptoms, and a lot of them are, teens and older people. A lot of them are not speaking out because they're ashamed, or, they're just living with it. And I know I talked to a teenager. He didn't know what was going on with him. And he almost committed suicide, like just recently, because he couldn't stand those, he had tinnitus, the sound in his ear. And that made me like, gosh, we have to do something for our people, for people. And I know not a lot of people will talk about this, but I'm glad I'm able to share my stories. And I'm one that Jackie had mentioned, with this neurological issue. I just recently, back in May, I graduated with my BA, and I was on to to pursue my master's degree. But this hit me. I have this neurological issue where I can't get on the computer. I can't get on the phones, anything heated. Like, I can't be outside for long. Anything heated, it affects my head. It flares, sends like a fire in my brain. And so I'm just, that being said, I feel that we need those services here on the reservation. And I'm sure I'm not the only one that is going through these. And I know a lot of people are not really saying much about it, but that's just my story, and that's what I wanted to share. So, but like I said, I'm on the road. I kind of just stopped the side of the road just to give my testimony on what I'm going through and how hard this is for me, because I feel like I'm on the stand. I just, like, my whole life has just stopped because, I mean, I was on this fast lane of going to school, getting my education. I lost out on meeting the deadline for my master's program. So because I'm not able to get on virtual, I'm not able to get on the phone, but I'm on the phone right now, but I have to put it on speaker and put way away from me. So, but that's what I'm going through. And it'd be, grateful to get some services that we get out off the reservation, here on the reservation, to help our people. Thank you. That's all I want to say. Have a good day, everyone.
Okay, thanks, Hope. Imelda.
Good morning, Hoditlasi.
Oh, Abigail.
Okay. Yeah, sinat ani dan senegido, sigedo, sidanedo, salaftoy. Sida Sanji Kenan Honaga, bus 16, 23, the city Tupa, the Sinala Dog, Canado, Arizona. The Hasnan the Adi Yanashako. I am an Army combat veteran as well, and I met Jacqueline Begay at one of the locations at the community center in Chinle, one of those facilities they put aside for COVID, people that needed to quarantine from being diagnosed with COVID. So I was diagnosed with COVID back in December. So although I am a COVID long hauler, although the stuff I am dealing with currently has decreased a lot, but there's some things that are still hanging on to me. I get anxiety attacks, which has totally decreased when I went back to work back in January and February. My anxiety was so bad, I would be driving down the road and I'd be stuck in the middle. My job is with the Veteran Affairs. I work for the Vet Center, Readjustment Counseling Services, and just as the young lady that spoke before me, I had just finished my master's degree in social work and was supposed to do my examination for licensing. I get anxiety attacks, and right now, just even thinking about speaking to everyone here on this call, it's like I'm shaky. One of the things a social worker shouldn't be dealing with. I still deal with a little cough, and I still deal with little issues like in the upper areas of my lungs. I get heart issues, like increased heart rate, swelling in my feet, unexplained bleeding, sleep issues. That's the kind of things we're dealing with as COVID long haulers. So, like I said, I'm trying to get on with my education, my helping profession. I want to be there to help my fellow veterans, and especially right now in the mental health counseling area. I know we need that, and that's really important. And I just want to say thank you to Dr. Adkins and her staff for also focusing on this COVID long hauler issue and the need for this. I think one of the big needs that needs to be putting aside part of the CARE Act money aside for mental health issues, maybe monetary help for those that go out to see specialists, like Jacqueline was saying, she goes to Mesa and Flagstaff. I mean, I'm sure some of them have lost jobs because of, the anxiety and everything that the symptoms of COVID long hauling. So, I mean, monetary donations. I mean, as social workers, I know through us, people talk through us. My daughter's a cancer survivor, and I've dealt with social workers down at Phoenix Children's Hospital. They offer gas cards, a place to stay for that kind of thing should be, I think, in the development for people who are dealing with the long hauling of COVID. So, and then also people who believe in the Navajo culture, like Mr. Johnson had mentioned earlier, to get that healing, get back with our culture as well. Money is needed to request services from Medicine Man. I grew up in that sense. I'm very familiar with the my Navajo culture. It's also the Zendo, Hojan, the Hagani, do Hatal, that any Sispahos and Hotaia. In Hinch Kedo, they put our base of budget dot Ank at the no by a distio at Aces that not in on Hinch K on distant Habella that was safe this no codon. Nit a hospital, les ado a head and Prago. Corridor.
Okay, Anthony, are you ready?
Present. Anybody hear me?
Yes, we can hear you.
Good morning. Yade, she Anthony Redhouse Chinisha. Not the Chini. National Code Chini, but Chin, this Chini. Kind of like this Nella. Doc Elanda Nasha. I'm the Vice Commander for Many Farms Veterans Organization. I'm a younger generation. I would like to say a little bit about dealing with the long haulers as I've seen. I'm only 31, but I've seen my parents contract the COVID, and thank the Lord that I still have my parents. One of the things that I've seen is some of the things that happened to them. Both of them have had COVID, and it was pretty scary seeing it from my eyes. I'm also a Marine Corps combat veteran, deployed 3 times, seen quite a few things, but by far this was probably one of the most scariest things that I have encountered. And not all of it was bad. My father's side, he kind of got a little bit better with his respiratory, and even stuff like that. I think we should maybe get some kind of care to maybe analyze, to document, and see why it affects people differently than it would help, or how it affects these people, as all in all. Some may be good, some may be bad. On my mother's side, on the other hand, she had like some of the neurological things, kind of forgetful. Another, like some things that she had before, underlying conditions got worse, and seeing it kind of puts everything into the younger generation's perspective. Like the ladies before me that have spoken, a lot of people don't seem to know or hear about anything that's going on for them, or for anything that the hospitals generally educate people on, or for the public. And we just stay in the shadows mostly. There's just not really anything that I've seen or heard about that does with the helping those of the long haul. And I would like to see, or instead of having our veterans who also are long haulers, rather than be closer to home, and instead of having to take long trips or have somebody of the family take them to out in town, whether it be towards New Mexico or down south to Phoenix, Flagstaff, Prescott, or whoever. So Like that, on behalf of like myself and my family, I have concerns as well. Just speaking as a concerned son to my elders, to all of y'all, my leaders as well. And so I think that we should have something in place locally, not necessarily just Fort Defiance, Chinle, but pretty much all the way around if we can. Thank you.
Yate, can you hear me?
Yes.
Okay, this is Marcus Tooley. Do I can't hear the additional question that ani do bayat hiki she ya tnesan inshli to hetlini bashichin ado to trani dashichi do ado to dich in edashinale ayesna shado epistot jindishkish bol ye ado shike ko tipa ya hiki it I see Diego it is ojon nilto ojotza to kwesh mande ik edan ditza adoshnande to ik edan ditza to nache kwe hasito lesti nashni hiki shi pate hollo ado Diego na isna atsis na isna ko ado to hojon pana hat idan halen o hot zato hot pachana hot no okoho sa ik etateslinki to bauhint idan to bayat hidato akoshindi di hotel natoshi ahigo nzao shin haljish khashin zachi azbi hajaga tatzelto akoho andi back end setalte Shinal nishe line trago bete desnato na ki ek edantit aj ado alla antike ik narado si yabachi na hotilto abachi na huin na kunza koljisho alech epeni kedo to ya to yanat endan hallen ako hote Akoshi di peso ki wo kedi shi bini yeko neche she yet do ye nache hostel do le to nache chios ishi o yuje peso hintel to ale was zel on was najeta to ko ekishi okay de ko nache be hadisten so ekoto niche hasito les ado ashibala kanak ishito les nana to good afternoon or good morning. This is Marcus Tooley. I'm originally from Blue Gap. I'm a chapter official, chapter president for Blue Gap chapter. Although I'm also the chairman of Zilligian Regional Council. There's a lot of talk about COVID and the effects of COVID. We put more emphasis on the prevention, but we're really not doing anything on the post COVID. And as I was mentioning, I lost my mom to COVID. I lost a brother to COVID. I lost several relatives to COVID in our community. Although I've lost workers, employees of mine to COVID as well. And we have one individual, one of our employees, that's continuing to suffer as a result of contracting COVID. And we were trying to look for assistance for him, like transportation to hospital or maybe even income. He's nearing the end of his benefits. Although, you know, this happened while he was still employed during work hours. So, you know, that portion is what I'm talking about. Maybe there should be more studies performed for post-COVID diagnosis and then contracting it. So I support Jacqueline Begay on what she's doing and what she's trying to do and bringing light to this. And as a nation, we should put more emphasis, maybe put more funding in that, because there's a lot of people that have are in that same situation and that same predicament as well. So I really do appreciate the time and thank all of my leaders, the council delegates, and then honorable members of this committee for allowing this to take place. And I think there should be more discussion from here on out on post-COVID. So thank you.
Ms. Begay, Shanola, does that conclude the presenters?
We just have one more, and that will be it.
Good morning, Chinanta, Vice Chair, Delegate Slater. This is Melvin Harrison. I hope I can speak on Delegate Slater as your LDA, but just like to give a last minute statement. What I just want to bring up is I'm also a veteran, post-Vietnam veteran from back in the early 70s. What I want to say is my wife did lose a number of family members to COVID, but I also had my late son and his girlfriend get COVID, and I'm the person that took care of them, so I knew what my kids went through. But I also should tell you that I have PTSD too, and from military issues and other issues that I've dealt with most of my life. So a lot of medication. I go to counseling twice a month. A lot of panic attacks. Few years ago, I had a lot of suicidal thoughts, and actually almost completed one. But through counseling, I've been able to work myself out of that. But with this COVID-19, I think a lot of our veterans are going through this. I know a lot of veterans in Chinle area that are walking the streets. I'm also in recovery. I walk the streets of United States in many cities barefooted and just with a swimming trunk for many years, because I didn't know who I was and where I was going. So a lot of our veterans are going through this, even here in Chinle. So they need counseling. And then with COVID, with them getting infected with COVID, that makes it like a triple whammy, a fourth whammy for them. And a lot of them, you could say, per se, homeless. Because alcoholism and drug abuse is seen as something that is not tolerated at home, even though family members do love them, but they can't deal with the illness. We don't talk about the illness of alcoholism or drug abuse. My wife knows that I have an illness. I'm an alcoholic and a chronic drug addict. So she understands that, and she doesn't push my buttons as much. So that's the type of thing that Jackie is talking about and is trying to put together. The PTSD or especially those ones that have been in combat. I wasn't in combat. I was just one of those individuals that took care of the refugees that left Vietnam at the time on ships and in Okinawa and in Camp Pendleton. But it took a lot out of us as young men and women at that time. But what's being discussed here, Jackie Begay is talking about here, is really a reality. If there's a possibility of using some of these ARPA infrastructure funds to establish a post-COVID-19 treatment center or program, whatever you may call it, but it's a post-treatment program. Something set up like what have been set up during the midst of the big pandemic that we had here on the Navajo Nation, like the centers that were set up in Chinle, Shiprock, and other places, where
where some of our veterans and even other folks that are not veterans can seek these treatments that Jackie and other folks are talking about. They're respiratory, even mental health, behavioral health specialists, because we know that the hospital is not set up that way. And I mean, they have enough patients up there. So with the funds, there could be possibility of getting specialists out here 2-3 times a week from outside or even from inside. Mr. Tim, I think it's Benali from Heart Rock. Traditional medicine is a really traditional, something that's greatly needed. I worked in a healthcare center from the late 80s to 2000 that was really seen as politically and morally and ethically wrong. It's something, this is almost something similar to that. Dr. Fati and all those people, the in the late 80s all the way to the 2000s, and Jackie also worked with me on this in the 80s as well. But it's a facility for these long haulers, even the young ones that are coming in. They need help with these specialist treatment, mental health, behavioral health, traditional services, even having religious programs coming in. That's what we need. I mean, I have panic attacks all the time. I mean, right now I'm sitting in my home, torn half apart, and I'm having panic attacks. I'm in my office with everything just sitting in a pile. So that's where we would go. But thank God, I seek services at Indian Health Services, and I trust them. And in closing, what I want to say is confidentiality is one of the biggest things that health providers need to abide by. You know, like our people, Navajo people, Native people have a mistrust of government, tribal government, federal government, state governments, and what have you. Because if I had COVID, maybe I don't want anybody else to know. Because as some of our speakers had indicated, how are people looking at me? Are people think of me that I'm not following the public health orders? I'm not following the education? Upbeat. That's what people say. The upbeat. Confidentiality is a bottom line thing that needs to be protected, even with alcoholism, even with drug abuse. I don't, now that I've told you, for me, I'm fine. I go to AA, I go to NA and all this. A lot of people, people today are afraid to go to mental health or counseling services because if someone knows mental health or counseling, the people don't have to know, and I try to tell my alcoholic veterans out here in Chinle, nobody has to know you go to mental health. Hospital appointment, that's all you have to say. The confidentiality is, I think, a big thing, but I think this is a tremendous need of what Jackie's trying to do, is getting these centers established. I would use it. I would certainly use it for mental health and behavioral health, traditional medicine. So, even na chiquitita peso, adik nakada nos is ada tabiga dohit oda tabiga din hot agot then he last so hot only hot the cut only honda kanahalen. I was at a veterans meeting up at such is a Rough Rock yesterday, and this is what they were talking about. Attendon his thousands. How the Shida treatment, how Shida Hadika, don't kiss Hanetta. That's what is the thing. So I'll be Hanadis. Thank you, and thank you, Vice Chair Slater, and thank you, Ms. Jackie Begay, for including me, and also Shanale, Mr. Kiel Begay. Thank you, and the committee as well. Thank you.
Thank you, Melvin. Otto, just to recap, for giving us the time Just again, this is a need. This is, like I said, this is our chance to get ahead for our people. I'm sure there's hundreds of people that got infected, and some of these hundreds don't even know what's going on. Like when I first started trying to get seen, I was told that it's, just write it out. This is from an IHS doctor, just told me write it out. But it got really difficult. And I just don't want to see any more of our people being told write it out, or just being heavily medicated with narcotics. But because even when you wake up, the symptoms are still there. And like I was saying, if we could get something put here, that would be very helpful to our people. We can take care of our people ourselves instead of sending them off the reservation and putting them at risk again. My life, like the other speakers, that has been put on hold. One of the chapter officials with Mini Farms chapter. I'm the secretary treasurer there. I'm also the secretary treasurer for the veterans organization as well. But like Tim Johnson said, I try to still do what I can. If you could really consider working and doing something for our people here, that would greatly be appreciated, including counseling that needs to be set up. Imagine what all these people are going through. I've met people, I've talked to people, I have letters, and you heard some of the speakers. And I just don't want to keep seeing a lot more of our people getting hurt and suffering because of this. Let's get ahead of COVID right now and trying to do something for the people who are considered long haulers. And, I'm here if you need more help, or if you, like another thing is I spoke to some of these non-medical transport drivers, and they said the same thing. So this is real. I'm dealing with it personally. But thank you for listening to us. Again, I'm here. If you need more help in trying to get something established, again, thank you.
Thank you very much to all of our veterans who presented this morning. Thank you very much, Ms. Begay. Committee members, I'm going to open up to questions and discussion now.
Chairman, Kudo.
Yes. Delia Begay, we can't really hear you.
That's not us. Can you hear me now?
Yes.
Okay. Kodoshi Hehan Hidini Dolis Health Committee other committee members of Senegi. Hikudo Hisindahas Nagidon Hisalaf Soki. I sincerely am requesting for a follow-up and how your committee can direct, especially the Veterans Office, although even the IHS in the program, how we can continue to coordinate. I mean, there's going to be, if funding is going to be requested, I mean, you know what the requirements are and how much money is being requested, land withdrawal, building. I mean, I'm sure licensed individual needs to be being employed and such. So, chairman, so Kodoshi,
Thank you, Sash. Committee members, if there are any comments right now, I'll offer a couple. Yesterday, we had a report from Rosalind So and Ms. Begay Chanela because of the conversation we had at the Say the Wheat Fields BlackRock Veterans Dinner. I asked her about what the strategy is for addressing the COVID long haulers, and she said that they're incorporating it into their current services right now, and that they're building that out. So there wasn't a lot of detail that was provided at that time. And I think, just like Delegate Begay mentioned, it'll be important to have a follow-up to figure out what services need to be consolidated either in a new facility or in a new program within IHS, or if it's really a matter of augmenting existing services, tailoring them to the specific needs of our COVID long haulers and better resourcing them. So at the time, she said there wasn't a plan to create any new facilities that were expressly for COVID long haulers, but instead to augment the existing services, and they're building that out right now. It's not something that was, how would I say this? We didn't ask her to present on that specifically and on the what the COVID long hauler treatment is going to look like. And I think that that's another conversation that we need to have. It'd be great if we could incorporate you and some of the experiences and the testimony from our other veterans who spoke today. It's good to hear you all, some of those whom I know and others whom I'm sure I'll meet. Mr. Johnson, if you could get in contact with Mr. Harrison, and I think you said 12 o'clock on Sunday. I think I can make that at this time, as long as I don't have a chapter meeting or a planning meeting scheduled for then. I know that a lot of the testimonies come from central agency veterans right now, and because of that, what I would offer is meeting with the service unit to discuss what those services are that are currently being augmented, and if there are additional, I'd say, tailoring how they're being augmented because of the unique medical needs of veterans. That's something. And if we get a request for help from IHS on how the Navajo Nation can, either with funding from ARPA or elsewhere, provide further support, I'm all ears to that. But right now, there isn't a proposal. I think the issue of healthcare in general for our veterans under the VA and trying to bring more of those services to the nation is something that National OSHA has been working on very doggedly for a long time. And I told him that one of my goals, this is not just for the healthcare side, is to get that Chinle Veterans Home up and funded by the end of my first term, or what I hope is my first term. And I wonder if there's a possibility to use some of ARPA funds or requesting from the state and then adding in to that design it's an increase in healthcare delivery for the veterans population on Navajo. That's not currently what's in there right now, but it might be a way to attract state investment and further federal investment. But it's not something the nation can foot the bill fully for right now, but I think we can help foot the bill for part of it. So I welcome your creative and innovative thoughts on how we can, expand services on Navajo. We know all the ways that the Veterans Administration and others have said no to us, whether it's the number of veterans we have and the services, or other things, saying that we already provide funding to get you to your appointments elsewhere. Just know that we know that that's very cumbersome from a leadership perspective. That takes its toll on vehicles or your time, your work, etc. And it's not something that we forget, but we try to confront and move past in creative ways. And it's a matter of adjusting our arguments and finding funding and trying to be creative. I pray for all of your health and safety and well-being as you move forward. Think that you're going to have days, and you've probably had them, where things are okay, and then ones where they really get crummy, whether it's your breathing, the anxiety, the panic attacks, or the sense of taste, the smell, just being able to enjoy your life the way that you were able to prior to COVID. And your leadership is going to earnestly listen to you. We are listening to you. But keep going. I hear from relatives and from friends who have contracted COVID and are in long haulers themselves that they do see modest improvements, or they sometimes will see big improvements to their health, the respiratory health, other things. But it takes time. And I think expanding traditional services is something that this council and I myself was particularly interested in doing under the CARES Act. It was vetoed, and then we just got the funding restored, and it just never ended up getting out into the communities, into people, into our hataslis. But in terms of the financial cost and how we would compose a new traditional public health and or traditional medicine expenditure plan under ARPA, I'm all ears. I think we have some good templates to work off of from the CARES Act, but you're welcome to reach out to me to discuss that, say, offline, and we can help build those expenditure plans as this moves forward. So, committee members, are there any final thoughts? Otherwise, I'm going to call for the vote. Going twice.
No, Keller.
Okay. Yes, sir.
Another area that I'm making recommendation, as you know, that I believe it's legislation 124 requesting for direct service veterans. Although you know that it was on the agenda yesterday for HES, and I indicated that I'm withholding that because I really need input from the local veterans. And I believe this type of request should be on that particular legislation, because when and how will the federal government help or assist these type of situation on the Navajo Nation? So, provide your input, recommendation to Shno. Did Heki Hajonal Sosadosa Goko Ain Happy Behest on Yat Etolishans. And that's my recommendation to this group that doing the presentation, that these type of a service is needed, and how can the federal government establish just a direct service on Navajo. So they that Heki after Shno that Alcodo Latin Washington, then hot air with Laton Hikash to Sato, even though the has no peso hat those happy been happy lands late down, that probably just going to have only the immediate construction and so on. But what about the years that's going to be coming forth, the operation and maintenance and employment? So it based on lineage other what they indicate or let the country had a hotelia. Based upon need for operation, maintenance, and employment. No, so that's my recommendation, Chairman. Asking all veterans or interest group to provide input and statement to legislation 124, so that this will be part of the record when we send this in, hopefully approve legislation to the federal government. Chairman.
Thank you very much. Yes, that legislation will go on to NABI, and at the NABI committee, we can definitely add some amendments to make those specific requests and strengthen the legislation. Welcome all veterans to reach out to the HES committee and your delegates to do that. One other thing I want to mention, some folks did talk about substance abuse and alcohol abuse issues. We made a request to Director So yesterday to help flesh out what the financial aspect of that would be, and Delegate Begay touched on, operational costs. The nation can always build something, but we don't have a great track record when it comes to ensuring that all the services that we've provided historically continue on for the benefit of our people. I think people may remember there was, a water delivery program that the Navajo Nation ran, and doesn't anymore. So things like that, people deserve it, and so this committee is dedicated to making sure that there's long-term vision matched with long-term operational capacity. Mr. Mose, can you please, oh, actually, we need a motion in a second to accept this report.
Mr. Chair, Vice Chair, this is Angie Benally.
Ms. Benally?
Mr. Chair and members of the Health, Education, and Human Services Committee, Mr. Delegate Kialan Begay as sponsor. If the group could submit their comments as a public comment to Delegate Kialan Begay's legislation, I think that would make it part of the record as far as his legislation is concerned for is it 01-21. That's one suggestion that they can have it documented. Thank you.
Thank you. Mr. Mose?
Yes, sir, go ahead.
Oh, actually, sorry. We need the motion in the second. The chair will entertain a motion in a second for accepting the report. Not all at once, committee members.
Motion, Juanita.
Second, Helona.
The chair recognizes a motion to accept the report from Delegate Wanika and a second from Delegate Helona. Mr. Mose, please proceed to the roll call vote.
Sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Helona. Honorable Pernell Helona. Honorable Pernell Helona votes green. Okay, thank you, sir. Honorable Charlene Stowe.
I vote green.
Honorable Charlene Stowe votes green. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Vice Chair, a vote of 4 in favor, 0 opposed.
Thank you very much. Committee members, we're going to move on to agenda item 5C, report update, Whitehorse High School, San Juan School District, Montezuma Creek, Utah. Presenter Kim Schaefer. I just received an email. Seems like she didn't know she was on the agenda. And I just let her know that they're up now. I'm going to defer to Delegate So on whether she would like to maintain this as an agenda item now or add this to a subsequent press meeting.
Shannon, HESI committee members, as I did briefly mention before, this is a part presentation with Doyle Anderson in the Fields Project. So it's not just along with Kim Schaefer, but it's mainly of the program that's happening at Whitehorse High School. And Mr. Anderson is there to present. And I believe that Ms. Schaefer will go ahead and give her input. So if we can allow this presentation at this time, Shannon, I know that we are kind of facing some time, and this has to do with a lot of the upcoming school year budgets, proposals, and I know that the state of Utah are waiting to see what the Navajo Nation may do and how we may act on this. So we will go ahead and proceed with the presentation.
Excellent. Well, Delegate So, you're recognized to start off and commence the presentation. Thank you.
Just a while ago, about an hour ago, I did present my introduction. And they totally condemn Nasha. I don't know. I don't know. Don't and show, but I bashin twitching that she check his chini dational. I don't see a Charlene. So a call yard nana hit the schneedle. But it then a sun anise Mexican water now create teaching red mesa essence. I don't quit it. Sugar Sweetwater, Arizona. A call. Based on this presentation with Whitehorse High School, we do have our scholars that are involved with this program. It provides a lot of forefront technical training. I know that at the beginning of high school, a lot of our students are questioning what they want to do with their lives, and the career options are so limited, especially when they are graduating. And so a lot of this comes into question: how are we benefiting and preparing our students for their future? And at this point, we're pretty much lining that up. We did have a good program that we have been sampling, that we have been giving a shot at with our scholars at Whitehorse High School. A lot of our students found direction of what they want to do with this program, the Fields program. A lot can go into engineering, a lot can go into oil and gas, as well as with electrical and many more options. Our students are able to get hands-on experience. And so at the time that they leave high school, they have earned credits to get certification, and some of them are close to being certified. Along with that, Shannon, after this presentation today, I invite my colleagues to come out to Whitehorse High School and to White Mesa Mill to see for themselves, for yourselves, how we are helping these students. And this is an initiative that I would like to see widespread on the Navajo Nation, especially with the Neck College, Navajo Technical University, Monty Russell, NTU. They are well familiar with this program, and they want to see this incorporated with their curriculum. And at this point, you know, a lot of our students leave for college. They're unsure of what they want to major in and what they want to accomplish in their life. That passion and that determination and that, I guess that confidence in what they're going to be doing, it pretty much outlines this for them. It provides much more options. And with this, you know, a lot of them are unsure, as I did state, but they accumulate student debt as they're in college, technical school, and you know, some of them don't want to do that within the first 2 years. A lot of our students drop out of college and universities because they just don't have that passion and they haven't discovered their calling. Present I will hand the floor over to Doyle Anderson, and this is the first time that he will be presenting to Navajo Nation Council members and HESI members. Mr. Anderson, if you're on the call, please go ahead and take over the presentation, sir.
Thank you very much, Delegate Stowe. Sunset, Doyle Anderson, it's an honor to be here with you. I'm a member of the Red Pheasant Cree Nation. My grandfather is the former chief of the Mosquito Bear's Head, Lean Man, Grizzly Bear's Head First Nation, it's the Assiniboine First Nation. And I have been working in Native American higher education and training, and also in K-12 education and training for many years. I also previously served as the president of First Nations University of Canada, the National Tribal University in Canada. And I've been working in the Utah Navajo Strip area since 2016, when our company first came forward and we were asked to deliver some mentoring training at Whitehorse High School in Montezuma Creek and at Monument Valley High School, which we did. In 2018, we were invited by industry, actually, in the area, Elk Petroleum, Energy Fuels, and others. There was a great interest and a demand for skilled workforce development in the area. And the Elk Petroleum, which is the majority owner of the Greater Annis oil field, the other owner, of course, being Navajo Oil and Gas. Elk Petroleum, the majority of their skilled workforce is been commuting in and out of Cortez, Colorado. People that come from far away, live in Cortez, and just commute back and forth into the Montezuma Creek and Aneth area for work. The company, the new CEO, has an interest in working hard to educate and train local residents for some of these positions, for technician positions, for skilled operator positions, and they reached out to our organization, FIELD, which is Facilitators of Innovative Education, Leadership Development, and Sustainability. And they reached out to us and said, hey, we would like to work with you because we need to try and train residents of Montezuma Creek and Aneth and the local area for skilled employment. We know that you do that. So we got started in 2018 working, and we're very honored to be invited into Whitehorse High School by Tim Schaefer and San Juan School District, who has administrative responsibility for the schools on the Utah-Navajo Strip. And we got started with some social-emotional learning and life skills, education and career development program delivery to the junior class at Whitehorse High School. And then we also began development right away of an electromechanical technology education program. And this electromechanical technology education program is really custom designed for the needs of local industry, work hand in glove with industry to develop this program. Our organization has delivered this type of programming elsewhere in Alberta and Saskatchewan, Canada, in Idaho, and now in the Utah-Navajo Strip, Montezuma Creek. And as we've gotten started with this program, it's been very exciting. We started out this last fall, and it was actually quite uncertain whether we would be able to deliver the program or not. And at that point, Navajo Transitional Energy Company, Nathan Pipsoni, had visited our site, had a chance to take a good look at our program, our curriculum, and he contacted me in really kind of in the heart of the initial phase of the pandemic. And he said, Doyle, what's happening with this electromechanical technology program at Whitehorse High School? And I said, well, the pandemic has caused us to put this on hold for now. We're looking at what our options are, but the oil price has gone way down, so the oil company investment in this project has been put on hold. Likewise, the mineral processing company, Energy Fuels investment, and I want to credit the Navajo Transitional Energy Company. Nathan said, well, what do you need? And I said, we've converted our curriculum to an online format, but we need home-based laboratories. We need to be able to send a very highly technical laboratory kit into the home of each one of these scholars in our program. And those kits are quite expensive. And he said, well, how much do you need? And I told him, and he said, well, what's your bank account number? He said, let's make an arrangement here to get this going. And that was really a key to getting the program started in the fall. We worked through the fall, partnering closely with industry. In fact, the lead technician at the White Mesa Mill for Energy Fuels, it's a uranium and vanadium processing operation, but it's shifting now into rare earth metals production. And this rare earth metals production it's a very big market, and they're looking at a significant expansion in that area. But they dedicated their lead technician to work with us. And so we brought him in, and he's worked as a lead instructor for our program. So the scholars, as they go through this program, they're able to get instruction from, directly from the horse's mouth, you might say, in terms of what's needed in local industry. It's very successful. It's been largely the last year online and hybrid, so it's a combination of online and hands-on learning. But the hands-on learning, as you know, has been very limited because of the COVID-19 restrictions. Toward the end of the school year, things started to open up a bit, and we were able to bring scholars into industry internships. And we were able to send scholars in and be able to get hands-on experience. They've been able to go in and get industry experience troubleshooting, electromechanical technology, instrumentation and control systems, and they've been able to, really get some great experience. And as Delegate So had mentioned, field in our delivering our program to the entire junior class of White Horse High School over the last couple of years, we've been able to really help students to understand, what it is that they want to do, and looking at local employment and career options if they would like to stay locally and avoid the brain drain that is so common for many of our tribal communities. And we've been able to do a lot of work there that's been quite helpful for a lot of the scholars. And then in the technology area, we're also looking at delivering an information technology program, a 6-month certificate in introductory software development that likewise has local skilled employment opportunities, because the high-speed internet that's being installed down in the region really opens doors for that skilled employment in a telecommuting manner. So there's companies, many of the technology companies in Silicon Slopes up in northern Utah, for example, they're short thousands of skilled workers, and they don't really care where you live. If you have the talent, they're willing to bring you in and provide a great career opportunity. So that provides an opportunity for individuals to stay at home in their own Navajo communities and work in these areas. So really, the work that we're doing, we've also been invited in in a discussion with the Navajo Nation. It was initially Rose Graham of the Department of Education. She and a group of people were meeting to discuss infrastructure, education and training infrastructure in the Utah Navajo Strip. And the message was that there's very little of that infrastructure currently available to people living in the Utah Navajo Strip. And she reached out to ask who can help us to start building some capacity there. And I believe it was Tony Daish, the administrator of the Utah Navajo Trust Fund, who said, well, Doyle Anderson and Field are working and doing a lot of good work. We need to include them in this discussion. And so that really opened up a discussion on, potentially establishing infrastructure, education training infrastructure in the Montezuma Creek area, but also serving other communities in the Utah Navajo Strip, with the focus of connecting Navajo youth and adults to employment in high-skilled, high-paying jobs in the local economy. We're looking at fueling economic growth in the Utah Navajo chapters through oil and gas and mineral processing technology, as I mentioned, but also water resource management. The Navajo-Utah Water Rights Settlement Agreement, or Water Rights Settlement Initiative, has created a great opportunity for access to a lot more water, and our program, the electromechanical technology program, provides capacity development in that area as well, and water resource management. So that's another focus area. Abandoned uranium mine cleanup, as that initiative moves forward in the region, the need for skilled workforce is significant, and our programs are closely aligned with the needs there. And then renewable energy technology as well. We also deliver, as I mentioned, information technology, but entrepreneurship as well. And so as we're moving forward, we're working to build a workforce and skills development center in Montezuma Creek. And that workforce and skills development center would also be a mobile training laboratory that would be able to take this high-tech training opportunity for local skilled employment out to other communities, to Montezuma Creek initially, but also out to Monument Valley, Red Mesa, and other communities as well. Even down into Shiprock, the Raytheon's facility there has a great need for skilled employment. And the Bond Wilson Technical Center, the Navajo Technical University campus there in the Shiprock area, they're the director of that center, and Nathan Putsoni from Tech have come out and they have expressed an interest in getting this sort of training made available to individuals in the Shiprock area to serve the energy sector, but also to serve this Raytheon, missile component manufacturing operation as well. So I wanted to speak just briefly about the youth and the veterans have had a very hard time with COVID-19, and I know that there's tremendous challenges there. The youth, really need to receive a lot of support to be able to help them to recover and then to really move beyond and thrive in their education and career journey that's in some ways has been somewhat interrupted with COVID-19. And veterans, I thought there were some really great comments that were made here, just previous discussion. I myself am a veteran. I understand the need that exists there, and a lot of this training that we're working and proposing to bring into the Utah Navajo Strip will have great benefit to veterans. And as I said, we'll also serve people in other areas. Our programs are holistic in terms of the way we deliver the programs. So in addition to the technical skills training, connecting people to the local employment opportunities, there's extensive social emotional learning, life skills, education, career development services that help with that aspect of the development of the whole person. And that's been a key success factor for us in the past. We're looking as well to be able to replicate and extend these programs to other parts of the Navajo Nation as the demand exists and as there are opportunities to do so. And as far as the delegates go, I'll kind of wrap this part of my presentation up here with just speaking to the funding opportunities that exist. I'd like to share with you the fact that it's been a few years ago that Lieutenant Governor Spencer Cox, at the time Lieutenant Governor Cox, I had a chance to meet with him. A meeting was arranged with a mutual friend, and this friend said, "Hey, Lieutenant Governor Cox, Doyle, Anderson, and Fields are looking to do something very significant in the Utah Navajo Strip, and you need to know about this. I'd like to give you a chance to learn about that." And so I presented the concept for what we're actually doing right now. It was just a concept at the time that we've actually executed now and are really starting to get traction and build momentum here. And Lieutenant Governor Cox, he said, the state of Utah has been trying to help move the dial in addressing intergenerational poverty on the Utah Navajo Strip for many, many years. He says, we haven't done that. We haven't been able to do that. So as you start moving this project forward, I want to be involved. I want to be involved and work with you on this. And so we have gotten him involved. And we've had extensive discussions with him and his senior leadership. We've also gotten the legislative leaders as well. The co-chair of the Native American Liaison Committee for the Utah Legislature, Senator David Hinkins. I've met with him numerous times and quite extensively. I met with him about 2.5 hours quite recently. And we were talking about the potential for Utah ARPA funding to support this capacity development, this building of this workforce and skills development center on the Utah Navajo Strip. And he is very interested in that. He thinks that it's time that the state of Utah get involved in a partnership, is the type of language that he used, with the Navajo Nation. And so this is what Delegate So was referring to, I believe, is that Senator Hinkins said, you know, we would like to have a funding partnership where if the Navajo Nation makes an investment in this, where then the state of Utah can come in and make an investment in this as well. And so talk specifically about what we're looking at in this project, and I'll just outline this very briefly. And then I'll just speak to a couple of other funding sources that are poised to get directly involved in this. The first element of our initiative is initial implementation with building these electromechanical technology mobile training laboratories, and also doing preliminary design for the actual center in Montezuma Creek. There's been land that's been designated. The ANIS chapter has passed a resolution supporting this initiative. The Navajo Utah Commission has likewise passed a resolution, and both specify a piece of property that's right near the school for obvious reasons, with a lot of dual enrollment programs that will be delivering there. And that first element is that this whole thing is over a period of 3 years. The first element is $6 million, in which Fields will deliver education career development curriculum to students integrated with Whitehorse High School curriculum for the 9th, 11th, and 12th grades, deliver Fields electromechanical technology training to 12th grade students at Whitehorse High School, which we have been doing, but we'll be shifting to face-to-face learning now. Design, fabricate, and deploy mobile laboratories. Customize and deploy the educational software system, field system for the Utah Navajo region. And as I mentioned, land has been identified on the northwest corner of the intersections of Highway 262 and Highway 162 in Montezuma Creek. And then complete the preliminary design of the Workforce and Skills Development Center, and then establish a temporary location for a workforce training center during design and construction of the center, and establish programs for re-engagement of adult learners. So that, I won't go into as much detail in these other two elements. I'll just speak to them very briefly. Element 2, full implementation with addition of information technology laboratories and a more extensive regional outreach, which we're looking for funding from the state of Utah, which I believe, based on discussions with the governor himself and also with Senator Hinkins, I believe the state will be open to a matched funding arrangement. And that will be a $6 million investment by the state of Utah is what we're expecting. And then element 3, completion of the center design, construction, and commissioning is $8 million. And that process, we're looking, and I'll just mention the last funders that we're working with, the federal government, the U.S. Department of Energy Tribal Programs Director and his assistant, they toured a Fields Training Center at another location, and as they met with us at this other location, they got a chance to speak. They got a chance to see the type of technology that's available. It's basically an industrial process that is established in a school. So it's basically an industrial plant, scaled down, in an industrial arts portion of the school that we've built into that school. And so being able to, when these Department of Energy tribal programs leaders saw, this technology and seeing high school students operating this technology was striking for them. And they've reached out and they've contacted me, and more recently, and they have said, hey, we love that program that you've developed. But he said the thing that we love the technology education, but what we love even more is what, I gave them a chance to interview one of our students in the program, and they said it's what that student said. That student said, when he was asked, what has the Fields program done for you in your life? This student was a student who was dropping out of high school before this. He had planned to drop out of high school. And this student said, the Fields program has given me meaning in my life. And the U.S. Department of Energy, Tribal Energy Program's leadership has said, we want to take that out to many, many more tribal communities in the United States eventually. We want to work with you in a longer-term arrangement. They're very supportive of this mobile laboratory training approach as well. And so that's one, one potential federal government partner. And the CIA Energy and Economic Development Office is another entity where, I've spent time meeting with the director there, and there's a great interest in them making an investment as well. And actually the idea of the BIA partnering with the Department of Energy, they have a memorandum of understanding for capacity development initiatives. And so that's the discussion that we'll be having is looking at the federal government making investment in this as well. I've met recently with the senior staff of Lieutenant Governor, not Lieutenant Governor, Senator Romney, former Governor Romney, Mitt Romney in the state of Utah, as well as the Senator Mike Lee, and had discussions with them, as well as Congressman John Curtis, who has a key role in these issues in this region. And they are very much interested in pushing forward support to build this capacity for the Utah Navajo Strip, to really build capacity and build economic growth and sustainable prosperity in the region. So, Delegate, that's the message that I'll share at this point. If there are other things you'd like me to add, I'll definitely do that. But thank you again for the opportunity to come here and to meet with you and to work with your people and to share this message with you today. Thank you.
Delegate So, does that conclude the presentation?
Yes, Delegate Slater, that concludes my presentation.
Shanant,
Okay. Committee members?
Yes, I'm sorry.
Oh, okay, you're back on.
If Ms. Schaefer's on the call, I just asked that she can provide some testimony on behalf of the scholars that have joined this program and how it has benefited. Ms. Schaefer, if you're on, please. And we will go ahead and conclude our presentation. And again, if we can, this coming month, if we can schedule a site visit, I would really appreciate that. And I really think that my colleagues should see this hands-on experience for the scholars. Thank you, Shanant.
Thank you very much, Delegate So, for the presentation. It's very informative. Committee members, the chair is open to a motion and a second, and the floor is also open for discussion and questions.
Motion to accept report, Wanika.
We have a motion from Delegate Wanika. Is there a second?
Delegate Begay, second.
Chair recognizes a motion from Delegate Wanika and a second from Delegate Begay. Committee members, are there questions and discussion?
Sorry, this is Kim Schaefer. I've had a little bit of technical difficulty. I don't mean to be interrupting.
Ms. Schaefer, if you would like to add to the presentation, you're welcome to at this time.
Thank you. I guess it's good afternoon, Yat A. I appreciate you letting me just chime in here. I was able to listen to Mr. Anderson's presentation, and I wanted the committee to know that all this past year, even during the pandemic, Fields was working with our scholars in electromechanical technologies. And every challenge that came up, you know, we were in distance learning. We figured out ways to put their classes online. We figured out tutoring situations. We're running registration right now under a canopy and we did lots of tutoring outside last year. Fields just did anything they could to get the learning to our scholars. They were awesome to work with, and I would fully support some sort of partnership between the state of Utah, Navajo Nation, Montezuma Creek area organizations to build that center like what Doyle was presenting to all of you. We're working to do a reopening plan and have our scholars back in person, which will be wonderful. And so I could answer specific questions that you have, but mostly I just want to add my voice to Doyle's. Our kids enjoyed the electromechanical technologies program very much. 2 of them had paid internships before the program was done. And, you know, anything that we can do, I think there's 2 things. Anything we can do to prepare scholars for life outside of high school, we should do. And anything we can do to instill economic growth on the Utah Strip or anywhere on Navajo, I think that that's a thing that leaders should be working on. I know you've talked about that before in other sessions, and I just appreciate the opportunity to speak with you. And I hope you have a wonderful day.
Thank you, Ms. Schaefer. Committee members, I'll go back to the floor. Committee members, is there any further questions or discussion? Going twice. Okay, going 3 times. Delegates, so I think that we should wait for Chair So to be back before we schedule the dates to go visit the school. I think the committee also would be interested in seeing the operations of the, Gentle Ironhawk Shelter under UNHS. So perhaps we could do a 1-day or 2-day visit to fully breathe all that in. My recommendation is that we communicate via text and email, and we can make arrangements. I think on Monday we're going to have our special meeting. So if that sounds amenable to you, I think we'll proceed that way. Otherwise, if you want to find the dates now, we can talk about it.
Most definitely, Chair. We can proceed after Monday, and once Chair Danielso does return. I concur.
Thank you. I'd really love to see all this firsthand. And I do have one question I guess I'll ask is, I heard industry, and then I also heard something related to software, silicon or whatever. Are those the 2 focuses, and what is the software engineering side or that focus?
Okay, so. Yes, Delegate Slater, it's not rocket science. The software technology training, it's introductory software development, and it's a 6-month certificate program. But industry, it's the skills that are needed, similar to the oil and gas and mineral processing, you know, the training that we're doing. Training individuals for specific employment opportunities, for lucrative employment opportunities in the local area. The same is true with this introductory software development certificate. And that program, it's often the case that industry will offer employment to the individual even before they start the program, on the condition that they successfully complete the program. And then the students with this software, introductory software development certificate, can go to work for these employers in these other locations, telecommuting, and then they can continue their education and training and their career growth and development. And often the employer will finance that moving forward. So it's basically a first step on that ladder that will take the individuals forward to achieving their career objectives and their dreams in the information technology sector. There's a little more information. Did I answer your question, Delegate Slade?
Yes, you did. Thank you. Committee members, last call for questions or discussion. Okay, Mr. Mose, can you proceed to a roll call vote on accepting the report?
Yes, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So.
I vote green.
And so votes green. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Honorable Pernell Halona. Honorable Pernell Halona. Vice Chair voted 3 in favor, 0 opposed.
Thank you very much, Mr. Mose. Thank you to the presenters. Thank you to Delegate So. Committee members, we're at close of meeting. Are there any announcements? Hearing none, the chair will entertain a motion to adjourn.
Motion to adjourn, Delegate Begay.
Second, Wanika.
Mr. Mose, can you please proceed to a roll call vote?
Sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Vice Chair voted 3 in favor, 0 opposed. Adjourned at 12:27 p.m.
Thank you, everyone. Have a good rest of your day. Good night.
Any questions?